Good morning, everybody. Nice to see you all. How's everyone doing? Good. Thank you all for being here. So for those who don't know, and I'll just say it also for the sake of the recording, this is a Tex-CHIP training. And so Tex-CHIP stands for the Texas Counselor Health Integration Project. And it is a HRSA funded, so HRSA is the Health Resource Service Administration. It's a federal funding source that has offered what's called the Behavioral Health Workforce Education and Training Grant. So Tex-CHIP is part of the BWEDGE, or the Behavioral Health Workforce Education Training Grant. And so today we're going to be talking about working with the homeless population and also acceptance and commitment therapy. So the first hour we'll have a panel discussion. And then after that, we're going to take a small break, and then we'll have a training on acceptance and commitment therapy. And then we have a really fun virtual simulation activity with VR that we're going to do at the end. So I'm going to begin by reading the case study, and then once the case study is read, well, actually, I can have the panelists go ahead and introduce themselves first, and then I'll read the case study. So would y'all like to go ahead and just introduce yourselves real quick?
I'm Chad Hollenbaugh. I'm with MHID, and I run Turning Point, which is a program for interns working with our population. Yeah.
Chris Leeth, I'm an assistant professor here and the editor-in-chief of the Journal of Creativity and Mental.
Hi, my name is Erika Martinez. I am the program supervisor of the PATH program at MHID. We serve the homeless population, helping them get vital records, short-term, long-term shelter, and things like that.
All right. I don't know what happened to our monitor. Maybe it's this. I think coming back. All right. It doesn't show up on my screen, so I'm gonna have to just read it through this screen here. But I'll go ahead and start reading the case study. Jill was a 24-year-old Caucasian female referred by a friend to an outpatient psychological services center. Jill was the younger of two children in her family, and her parents had divorced when she was in preschool. Jill enrolled in the military upon completing high school and ended her career upon completing 4 years. Jill eventually transitioned to a food services job and had a long history of poor job performance and retention in other low-paying positions. Initially, Jill lived in a small apartment with her boyfriend, who was several years older than her. Due to ongoing issues in their relationship, Jill ended the relationship and began living temporarily in a shelter until she was unable to remain there due to breaking shelter rules for fighting with other residents after they tried to steal her belongings. This resulted in Jill experiencing an ongoing period of homelessness for nearly 2 years. As a homeless individual, Jill faced a myriad of challenges which exacerbated her existing mental health issues and increased her susceptibility to traumatic experiences. Jill's living situation heightened feelings of insecurity, hopelessness, and isolation. For Jill, access to basic necessities such as food, shelter, and hygiene facilities became a daily struggle. The uncertainty of where she would sleep each night and the constant search for resources contributed to her sense of vulnerability and distress. Moreover, living without a stable home exposed Jill to harsh weather conditions and limited access to healthcare services, posing significant risks to her physical health. On occasion, she would reside in other shelters, providing temporary relief from sleeping on the streets. However, Jill was subjected to overcrowding and unsafe living conditions. Jill often had her personal items stolen and got into more fights with other residents at the shelter. The lack of privacy and personal space increased feelings of discomfort and further contributed to her emotional difficulties. Jill's experience of homelessness intersected with her history of substance abuse. The stress and uncertainty associated with her living situation intensified her reliance on drugs and alcohol as a coping mechanism. Her history of using methamphetamine and alcohol as a pattern of self-medication was to her a response to the challenges she faced while homeless. Jill's experience of homelessness intertwined with her mental health struggles and substance abuse issues, creating a complex web of challenges that she needed to address in therapy. Jill was able to secure temporary housing with the help of a local community mental health agency. When she presented for treatment, Jill stated that she needed help with three issues: find stable housing or shelter, stop her drug use, and get her help in dealing with her sexual abuse history. At the time of intake, Jill reported that she was using methamphetamine 6 to 8 times per month following her time in the military, drinking alcohol 2 to 4 times per month, and occasionally using cocaine and marijuana. She also reported smoking 10 to 20 cigarettes per day. With respect to her history of traumatic events, Jill met full criteria for PTSD related to a history of sexual abuse. By her report, the most distressing aspects of her post-traumatic symptoms were intrusive memories of the events and the problems that this caused her in her sexual relations with her ex-boyfriend and people she encountered while homeless. With respect to family, Jill's mother had a history of substance dependence and major depressive disorder, and Jill's father was absent for much of her childhood. Because of these factors, Jill was frequently left alone and not carefully supervised throughout most of her childhood. It was during these periods of inadequate parental supervision that Jill was first sexually victimized. Jill reported that she was sexually abused by her uncle from the age of 5 to 7. At age 7, Jill disclosed to her mother that her uncle was hurting her, and her mother took her to see a psychiatrist. However, Jill reported that the psychiatrist was a physically imposing older man with whom she didn't feel comfortable, so she would not speak to him about the abuse and stopped attending therapy after a few sessions. Jill reported that her next sexual victimization occurred in the military. As a result of these traumatic experiences, Jill reported that she felt very different from everyone else and had problems with mood, body image, and self-esteem. In an attempt to get rid of the negative feelings that she was having, she began drinking alcohol with her older brother at the age of 14. Drinking alcohol quickly advanced to her using illicit substances following her time in the military. By the time she was 22, she had tried most available drugs, including marijuana, cocaine, heroin, Valium, and methamphetamine. Finally, because of her drug and alcohol use, she spent time with many people who are older than her and also using substances. Because of her current historical problems with substance abuse, Jill qualified for free psychological treatment under auspices of a treatment development grant, evaluating the effectiveness of acceptance and commitment therapy for substance use disorder for substance abusers. As part of the grant protocol, Jill completed a number of self-report measures like the MMPI-2, Acceptance and Action Questionnaire, White Bear Suppression Inventory, Automatic Thoughts Questionnaire, Symptom Checklist 90R, and the Beck Depression Inventory. At intake, throughout the course of treatment, and at 3-month, 6-month, and 12-month follow-up points, on the basis of conceptualization for this case, it was determined that Jill would benefit from acceptance and commitment therapy with its focus on reduction of experiential avoidance, acceptance of private events, and commitment to behavior change. Okay, so now our Tex-CHIP graduate assistants, doctoral students are going to facilitate the panel discussion. Thank you.
I am Ellis. So our first panel discussion will be, are there any additional diagnoses you would assess for Jill?
So it's PTSD. What were the other diagnoses?
It was
Was there substance abuse
Yeah.
diagnosis?
substance abuse, because she
Some of
was
these there was depression.
PTSD. Sexually assaulted or molested as a child. Yeah, those are the ones.
Substance dependence and PTSD then.
Mhm. Um. So are we asking what the diagnoses are right now?
What additional, if any?
I think one that's common, especially in Jill's case, may be borderline. And it's hard to say that without sounding like I'm just kind of stereotyping what leads to borderline. Um, the amount of trauma, the chaoticness, she had the type 1 trauma from the physical abuse and the sexual abuse, and the complex trauma of the family relations and betrayal and things like that. And it makes for such an unsteady context, right? She doesn't know where her footing is. And so when you're really scared and someone gives you this much decency, you feel very safe. And then when they disappoint you, either like they actually abuse you or they just make a genuine mistake. I forgot that we had lunch scheduled today and I miss it. It hurts a whole lot. And so then we have the hot and coldness that is very typical with borderline symptoms, right? That I feel tremendously safe and tremendously cared for. And at the slightest provocation, I feel tremendously betrayed and tremendously hurt. So that would be one of the first things that I would just look at, mood stability and how she kind of conceptualizes her relationships.
Question number 2, what are some other assessments that might be helpful for Jill?
We just use the QMHP 9 or something like that, which has more health things on it, along with some basic mental health stuff. So that would gives us a broader idea of what else they're dealing with besides just what they're coming into kind of being asked to be treated for.
I think another cool assessment, I don't know if y'all are familiar with the SASE. This kind of helps like gauge like the alcohol dependency. So that's a good place to start. So especially dealing with the homelessness, they tend to not minimalize what they're going through, but their biggest worry is where they're going to sleep next. So kind of doing that, we do the CSSRS assessment at MHID, gauging if she's having any suicidal ideations. I feel like it's not really discussed in this case study, but when dealing with a homeless person who's experiencing homeless, you have to gauge it in a broad spectrum because they're not going to report everything, but you have to kind of read in between the lines because they're just worried where their next meal is going to come from. They're worried where they're going to sleep. So kind of like getting a closer gauge of what this person is going through would be interesting to see through the CSSRS and the SASE assessment.
Thank you. What resources might be helpful for Jill?
Seems like she could use a whole lot. So healthcare and things like that, which you guys would know how to do that more,
Yeah. So,
connect them with.
I think the first part is to definitely link her to like OSAR services. So those are substance use and recovery services. She did verbatim mention that she wants to work on her substance use. So that's something that you can always link her to as well. To address that homelessness and kind of that the sexual assault that she reported, you can always look into shelters. The important thing is to get them off the streets. They want to do the substance use, they want to get shelter. Because you're not going to be successful in giving her any other resources until you address those basic needs. So any local shelters, substance use, of course, mental health. I know it was documented that she went to a mental health facility, so making sure that she had stabilized that medication. That's a good place to start as well.
Do you guys know OSAR? It seems like you kind of mentioned that, but I don't know if
OSAR,
they would know what that is.
OSAR is basically like it's substance use and recovery. So it's linkage of services. So they meet with an LCDC. Are y'all familiar with like an LCDC kind of? Okay. And then they do an assessment with them and then they help them get into substance use treatment. This can look like Senecor, this could look like sober living. This can look like transitional housing. Like it's really depending on what the drug the person is using and where they're wanting to start. So it's important to get that assessment because regionally, tropical behavioral health they use CMH.
I don't do claims.
So they use a database that they have. I don't know the exact name of it, but it's able to, everyone can have the information on the client. So if they do need to relocate, or let's say if Corpus is kind of a small city, we don't have any residential beds here, we can always ship them to somewhere that they can get the service they need right away. And I will let them know the name of that database. I'm so sorry. I don't know the name of that database.
So other resources, if they have any support, like social support, I don't know, doesn't sound like she has much, but connecting them with whatever resources she has, trying to reconnect them with any kind of support that she naturally has, would be, I don't know, something I would look for to see if there's anything like that.
So making those Maslow hierarchy needs are being met.
Yeah, for sure.
Okay. Oh, 4. How would using ACT benefit Jill's specific intervention?
So, and some of you have heard me talk about ACT. You know, there's a lot of different people, there's literally 6 pieces. One of those pieces is values, right? And so, after I 100% agree, this is all stuff that happens after the health, after safety, after that foundation is set. It's not at the same time. All of these things have to be taken care of first. Then it's, Jill, what is important to you? What kind of life do you want to have? Because part of acceptance and commitment is you are taking action, right? One of the 6 processes is committed action. What they mean by that, though, is that it's committed action towards your values, right? So she says, I want to be healthier. I want to move away from the substance use and the abuse, and I want to have healthy relationships. Then she would, in theory, take steps towards that, right? So part of how ACT can help is, what do you want to do? What kind of life would you like to have? And she has a lot of stuff going on. So her immediate knee-jerk reaction, I shouldn't say knee-jerk reaction, is going to be, I want my own place. I want money. I want continued safety. And those are all wonderful things. Those are goals. Once we get those things established, though, that's not the end of your life, right? So in other words, having money and safety, that's all you want to do, right? And so, and she will, you know, probably say no. So what are the other things that are important to you, and moving towards it? The other part is, she has this long history of abuse and like mistrust and being betrayed and hurt, and then instability, right? She was hurt by people perhaps she didn't even know. So then it's this fear of, how do we manage that fear that when I see, you know, they mentioned the physical therapist, he was this imposing man. Yeah, it makes complete sense. That was kind of scary. That was uncomfortable if you've been abused by other men. So what do we do with those thoughts and those feelings so that I can continue to move in the direction of my values? And so ACT would have those interventions to help manage all of that internal stuff without kind of just saying, oh, what are the chances that it'll happen again? Because it happened multiple times. That's really scary for her. It's a risk. So how to manage all of the internal chatter, so that she can kind of look and say, here's the reaction I'm having, learning to retrust her instincts about what is safe and what is not safe, and move towards her envisioned life.
How would you include other professionals to provide treatment and an integrative approach?
We really need to do that from the very beginning, trying to get, if I had somebody just come in, I would, and my unit is kind of separate from the other services. I would kind of immediately start thinking about linking them with a case manager or whatever it is, like someone who can connect the OSAR, something like that, who can connect them with other services, whether that's medical or housing or whatever it is. I don't do any of that, or we don't do any of that specifically, or so wouldn't need to bring in other people right away. If they're in crisis, if they are having suicidal thoughts, that would be the first thing we would look for, and then connect them to the crisis services, whatever that looks like.
So in my program, or I know you've heard about peer support or rehab therapy technicians. So these are people who have lived experience. So if someone were to come in with a specific case, I would know that kind of the first stop to build that rapport is to have her meet with our rehab therapy technician, just so she can feel comfortable and disclose everything that we need to. And then after she makes that report and they're able to talk about their experiences and kind of where they're at, we definitely want to link them to the case manager. Because the case manager is going to be a little bit more technical. They're going to offer resources, as a rehab therapy technician can kind of serve as like, this is where I was at when I started and this is where I'm at now. They're kind of giving them that little encouragement that they don't have when they first walk in our doors. So anyone who has lived experience, that would be a great professional person to include. Anyone who is an LCDC, anyone who does NA Anonymous or AA classes, that's definitely something that you would want to link to her to really focus on that substance use, because that's going to be the start of her whole treatment plan, is really addressing her sobriety.
And this, if someone like this just came into a counseling setting, I would actually slow things down. Sometimes they want to come in and just kind of share everything and get it all out, but they're not really necessarily have the tools they need to deal with getting it all out to somebody, and especially somebody new. Then I don't know if I'm going to see them again soon to kind of follow up and keep helping them. Some of the counseling stuff that she's been through, it seems like she needs to see somebody consistently in order to kind of bring it up and then deal with it. She's coped with this for a long time, and I wouldn't want to kind of take away some of the ways she's coped with it, even if it's not very healthy, until she's in a better place to be able to deal with it. So slowing down and getting to these other services would be important.
I think the group that's around like AA and NA and stuff like that, 100%, the peer modeling and role modeling. And then I think when appropriate, moving into even psychoeducation resources for relationships, the DBT groups for distress tolerance and emotion regulation. I would imagine, it's not explicitly stated, I would imagine that there is going to be some growth with how she expresses her needs and wants and reactions in an effective way. And so I think having those skills groups and, my thing is always how we relate to other people. So I'm always going to recommend some kind of education or resource for healthy relationships.
So real quick with AA and NA, I don't think it's the end all be all, but they are really good at a lot of people being there and having kind of support. Their meetings all the time. They're not hard to find, things like that. So that can be a really good resource in terms of just some kind of social support.
And that turns into 24-hour support. So a lot of agencies were Monday through Friday, 8 to 5. This person can be having feelings of that they want to relapse at 6 or 7 p.m. That's why linking them with a sponsor is very important, because we can only do what's in our job description on our units of operation.
What suggestions do you have for novice professionals to be mindful of when working with a case like Jill's?
Bringing other people involved, getting, like, I guess we've been talking about that, but really not trying to do it all yourself here, because it's a lot, and she needs more help than just what you're going to do as a counselor.
I think being present, like in the moment, and kind of just having that empathy factor. I know I find myself doing this too, as like a working in social services. I meet someone and I hear a case study, and it's like, okay, let's start game planning. She needs this, she needs resource, and that's not how humans operate. So it's kind of just sitting back and just having that empathy and hearing them out. The clients are going to tell you what they want to work on. So you start on where they want to work, and then just go from there. So kind of taking that step back, just being a person
And being really trauma informed, which
Yeah.
I think is kind of just second nature, but that's something you need to think about a lot, is these people, whatever we're dealing with, what have they been through? Is there just being careful not to, like, me as a guy, I'm careful about not just being in a room with somebody who I'm just meeting for the first time. Like closing a door and being in a small room doesn't necessarily feel safe for everybody. So all that kind of stuff, just being aware of that they've been through a lot. You got to be careful.
And that, cases like Jill's are not uncommon, right? And so when you look at it, especially when you're new, there is this maybe tendency or this pressure of like, I don't know what to do. It seems so impossible. It seems insurmountable. And it is a lot, right? You shouldn't ignore it, and Jill shouldn't ignore it. Change in recovery is absolutely possible. It does not always happen on the timeline that we want. It doesn't always happen on the timeline that our clients want. For Jill, right, we have trauma and addiction, like at a minimum, right? If we had to like tell me in 2 seconds what's going on with this client, trauma and addiction, right? Each of those are really, really big things. And each of those things is a marathon. Focusing just on the addiction piece, it is much easier for her to maintain her behavior and to get high, right? Than it is to enter recovery and maintain recovery, because she has to deal with all the stuff that she was putting off or avoiding by getting high. Right. And so, and it's easy. Like, look, you know, how many liquor stores do you pass on the way home? Right. And so, and you have friends, part of recovery might be, especially if she does do a 12-step program, will be you may need to leave your peer group. Right. So I'm now left with, I do have a peer group, but it's really bad for my recovery, or I can do something that's good for my recovery, but I'm going to feel alone. Right. And so it's a marathon. Right. And so that part of it is validating her with, it's not always a linear path. It's kind of up and down. And then also for you to give yourself that grace of you, as much as I hope that you will knock it out of the park on your first swing, you won't. And so, I mean, maybe you'll be the one, and then you'll remember me and how I taught you, right? So I can retire. And so you might do that, but if it doesn't happen, that doesn't mean that you're a bad counselor. It doesn't mean you're ineffective. It doesn't even mean that you don't know what you're doing. It just means it didn't work in that moment with that person, right? And then for both of you is that the world will continue to spin regardless of how much you're both trying. So here's Jill, she's trying, she's putting in this really earnest, full force effort. And then the shelter she's at closes, right? It's completely beyond her control. And now she's got to deal with that, right? So the world, unfortunately, will not stop because a person decides to change, right? Even if they're trying their hardest. And so, again, that's normal. And so us being able to be flexible and understand that our planning, what we had planned for this session or long-term, may pivot here and there to accommodate those things or to reprioritize. And then for her to understand like that is awful, how frustrating. We're not minimizing it. What can we do in managing the reality with the frustration, right? And that can be difficult. And I say all that and it sounds heavy, and it is. And also recovery is possible, just not always on the path that we initially envisioned.
Yeah, we actually, you also need to be, I don't know, but welcoming if they do make a mistake or they do, like, I try not to, we try to set goals they want to accomplish, but then if they don't do it or they relapse or something like that, I want to make sure that I'm not disappointed or not showing that I think they screwed up, but okay, well, you know, what's the next step? I'm glad you came back and we'll keep going kind of thing. That makes sense.
I kind of like what you said earlier about like reach out, you know, you're new to the field, you're not going to know how to do everything. That's what community partners are for. We have a lot of coalitions within New Oasis County.
Yeah.
Everyone is an expert in their own way, and that's why, you know, 6 brains is better than 1. So definitely always don't be afraid to ask for help when you're not necessarily sure what to do.
And we're all in the helping field. So I think if I ever got a call from somebody, and I know I've called, say, the Purple Door, and they're just like, oh, I'm glad you reached out about this situation. And they'll happy to talk it through with me. It's just kind of a consulting thing. People want to help each other. And if you have an expertise in something, they want to share it. So vice versa.
In your own profession, what personal example can you share regarding clients with similar symptomology when using ACT? I know y'all may not specialize in acceptance behavior, so just in general.
Not necessarily with ACT, but that kind of like cognitive diffusion. Sometimes people aren't ready, and sometimes they're just really heavy in those negative thoughts or really heavy in their past experiences. And as someone new to the field, that can be really off-putting because you're not helping. You feel like you're turning your wheels and they're not getting any better. I think taking the time to do like your self-reflection and just realizing that, hey, that person's not ready. It's going to take 6 or 7 times and just kind of like regulating yourself. That's really important. That's something I had to do when I first got into this field. It's just because they're not ready doesn't mean they're ever going to be ready. Just make sure that you're kind of always keeping an open mind when it comes to treating clients. So
Sometimes maintaining kind of where they are, maybe they've been hospitalized a lot and we're keeping them
Yeah.
out of the hospital. They're not kind of where we want them to be. I guess it's us accepting.
yeah, and it's like,
like
oh, I'm not a
that-
good counselor, or I could have offered this resource and I didn't do that in the moment. Like just kind of just looking down on yourself, and sometimes in reality of it, they're just not ready. They have some stuff they need to work through. They will come through your doors when they're ready.
Yeah, I agree. I don't think I can say any better that patience for the situation, your client, and for yourself. And that their what they envision for their health and wellness may not be what we would do. And sometimes there's just a value difference. It's not a professional thing. It's like, that's not what I would do, but that doesn't make either one of us wrong. It just means that's what they think is best. And is there a way that I can sort of honor that while still being professional? And clients sometimes come up with things that you would just not think to do. Right. And again, it can kind of be jarring, but the number of clients who have come up with something that I would have never guessed and it worked is really high. I mean, they have really good intuition once they're able to kind of think and kind of process what they want to do. So also just trusting your clients' ideas and thoughts and values, even if they don't necessarily align with the theory you're using or what you would personally do in that situation.
That's all the questions we have. We still have the time now. Students, do you have any questions for our panelists?
Yeah, like if you're making the team, right, like I guess Chad, my understanding of your position, right, it's like you're the coordinator of Turning Point in my mind, right? So I mean, I'm thinking that you kind of assign like who's gonna be somebody's counselor, right? And I might be completely wrong.
No, that's right.
It's just how your position. But with like this case in particular, right, if this is a client, a female client who's been like a survivor of abuse at the hands of like men, right? Like what is your thought process on like whether or not to assign a client like this, like a male counselor, or even when it comes to an integrated approach, like how many male professionals like are you wanting on like this treatment team?
So it depends on their role. So like in counseling, you're in a room just with them. That's really kind of confined. If it's the psychiatrist or something like that, it's telemedicine, or there's a nurse there with them. That's not and they kind of understand that. So it depends on how kind of intimate it's going to be. So I'm pretty aware of it. I guess I'm aware of my presence. But also I don't know the clients very well before we do the intake. So I may assign them to a guy and it doesn't fit. So I don't know, we try to be aware of that, but yeah, it just depends on if we get information from the case, like if we get a referral and it says something about it, then we'll try to take that into account, but can't always do that, I guess.
And then to kind of expand upon that too, or act related, like on this topic, right? I use ACT, right? And I've had clients, female clients who've like survived, abuse at the hands of men, right? Like how can that situation like that gender dynamic be utilized in ACT to like kind of help out with like the acceptance component, like the diffusion components?
So part of it, and I'm guilty of doing this, is that with ACT stuff, the underlying foundation of it is that relational frame theory, right? And so without kind of getting into the nitty gritty, right, is that we make a set of rules. And so here's someone who has been abused by men. A rule might be men are abusive. And it's, in fact, Stephen Hayes says you can't unlearn something. So once that rule's there, it's there forever. However, you can minimize the influence it has. You can get it very close to zero. And so it may be that it's not just the fusion, right? The fusion would be that rule is in my face. So if there's a female client and they work with you, Trevor, and the immediate rule is this guy's going to hurt me, right? That's the fusion. It's right there in front of her. Now, even if you diffuse it, right? Like you're under trust, or we have a chaperone, or we do something like that, the diffusion will happen, but the rule's still there, right? You're you're a safer one, right? For a guy, you're not so dangerous, right? And so part of it is addressing the thought and what role do you want that thought to have in your life? So it's not in front of you anymore. It's not fused, but it is still there. It is still in the script of this. And so when you're out and you're going and you need to stop for gas and it's late at night, which would, nobody would doubt, like, yeah, maybe you're a little more anxious. There's another guy in the parking lot filling up. What do you want to do? Do you immediately want to panic and flee? And sometimes that is appropriate, right? It's all contextual. But in the case of using it in counseling, it would be helping her in that moment when she sees this male therapist. She's having the reaction and processing with her in real time. Tell me where you're at, which is what ACT is. It is a very here and now approach. So if she's having that reaction, Hayes and Harris would say that's fantastic, right? Because right then and there, we can do it. It's not something that happened before, and it's not something that will happen later. You're here, tell me where you're at. So you might do like the grounding stuff and the mindfulness stuff to try and figure out where she's at. I don't even know if I'm answering your question anymore. I'm just sort of talking.
So in that case, do you just have to pick up that they're uncomfortable?
Yes, and that's what they say, that it is very much you are present. And so with ACT clinicians, you would practice ACT yourself, which means you are being present, which should go without saying, right? When you're with your client, you're not thinking about last night's argument or whatever task you have tomorrow, but it is being cognizant. And so it might be picking up. I get the sense that maybe you're a little guarded, and it's the stuff like the body language. You might be checking in, especially if you have their history, and saying, what is it like to work with me, right? And so to one, it's good information for us. And I also err on the side, Shannon, I think this is what you're saying, is that if that person is so uncomfortable, maybe like that rule or those thoughts are so strong, maybe it is just more efficacious to find a different counselor, if possible. That's not always possible, but it's, do you want to be right or do you want to be effective? Yes, I think ACT is effective. Yes, I think we can get through this. I am not so into it that it's like, I don't want to do it at the expense of prolonging the person's experience, right? Like, here's another available counselor that it will help expedite things. Then like, let's go do that.
But often addressing it, I think, helps. Saying, you seem uncomfortable, is there something going on? Or just being aware of personal space. I guess it's all just trauma informed kind of stuff.
Yeah.
Our chairs are by our doors, so we can escape, but that kind of puts the client at the other side. So being aware of that and trying to give them space and, asking them to shut the door and things like that. It just depends. Just being aware of them and trying to, and that's probably for guys more something to be aware of, but for anybody, you need to be aware that you're putting them in a vulnerable position and we're asking them about sensitive stuff, and they're not used to that, or they may not be used to that. And so being aware and checking in with them can be helpful. Yeah.
Through the lens of acceptance and commitment therapy, how would you address, oh my gosh, I just had the word. Okay, through the lens of acceptance and commitment therapy, how would you address resistance to therapy, sobriety, or just change in general? What is your personal program?
I personally don't like the idea of resistance. I don't like viewing our clients like, that feels very adversarial. And I think I mentioned, I said this to my students all the time, that if they're not ready for it for whatever reason, I don't view it as like they're resisting it as much as that's not where they're at. And so I don't know if that's ACT specifically, but coming alongside them and seeing where they are, what do they want to change? I feel like if they're resisting, then it's something I want them to do, and they're not there yet. So, but that's
I would kind
You're
of go
asking?
to like the short-term goals, right? You go through values or short-term goals, set a date, like, okay, you wanna do your sobriety, you wanna do your recovery this way, let's revisit this in a month. And see where you're at and kind of just like always like interchanging that in that treatment plan. But you're allowing them, giving the autonomy to make the decision themselves, but it's also setting realistic goals for that client.
Yeah, I agree with both, and both of those fit into ACT, which is like whatever plan is developed has to be workable, right? And so resistance, or if there's a better word, hesitancy or trepidation over it, it just might be an indication that this is not workable, right? And so moving to a much lighter example, someone who says, I want to start working out, I want to start going to the gym, and you say, great, go to Venice Beach where like the original bodybuilding gym is. They're probably, that's gonna be too much, right? Throwing them a person in the deep end, right? And we say, so what? Someone who has panic attacks. Oh, just go to the mall. Just walk around the mall one time. But like they're telling you I'm too afraid to leave my house, right? And so it's not workable. So the resistance or the hesitation there is an indication to us that this is maybe some, no, it doesn't mean it'll be that way forever, right? It might be restructuring the goals, right? And so instead of leaving your house, what if you just kind of opened a window or opened a door, looked outside, you know, and do things like that, but building up so whatever that resistance is indicative of starts reducing, right? And sometimes it is fear, so exposure would help. Sometimes it's the context. It is this in this season of my life at this time, this is too much. I can't afford to have a panic attack. I have a big exam tomorrow, or I have a family coming into town. I gotta have a clear head, you know, whatever it might be. So there is a place to explore that, and what role does it serve? And is that role perhaps protecting the person?
Such a complex, intersecting challenges. I connect to, when we were talking about how overwhelming it might seem initially, but kind of resolving that by bringing others in, or the urge to maybe some like frustration to call this like resistance, but reminding yourself they might just not be ready. What other sorts of challenges do you like those kind of come up, either practically or like for your own personally?
If they're homeless or something like that, getting them to continue on a regular basis can be really challenging. Transportation, things like real practical things. To see them kind of week by week is hard. So helping them link with other things, other resources to get those base needs. Personally, I don't know.
Kind of like in the PATH program, it's kind of that re-engagement or keeping them engaged is kind of one of our challenges, because in reality, it's, you think getting an ID is you just go to the UPS and you're done. But for the homeless person, it's going to be 6 steps. So kind of keeping them to, make your appointments, we'll pick you up here, where are you going to be sleeping that night? It's kind of difficult. We do have some success stories, but that's one of our major challenges, is always making sure that they're making their appointments. If they don't come in, do we know what areas they hang out with? Are they incarcerated? So always just kind of knowing, building that rapport to know where your client is going to be at all times. It's kind of challenging.
So it can be disappointing if you're working with somebody and making progress and then they disappear, or you don't see them for a long time.
Yeah, and personally, my challenge is I'll be at an encampment at 8 a.m. being like, hey, kind of just be, kind of going above and beyond just to make sure that this client is okay. So sometimes I do have to pull back, like when they're ready, they'll come in. you don't have to go to the encampments, you don't have to do shelter checks, like what they will make face whenever they're ready. So I think that's something I'm always having to step back and be like, hey, like, you can only do what you can do.
Yeah, sometimes they have more important things in their life. You kind of feel like I'm working with them and I want to help and they're pretty important to you for that period of time when you're trying to help them and seeing progress. And then, maybe you're not that important to them.
Yeah.
They have other stuff they got to do.
normal,
Yeah. Yeah, you get really attached to some of these guys, but it's hard at some point, can't take it too personally. I guess I'm trying to think if I take it personally. I probably do on some level, but I don't think so. Like you really want to help and attach, but having in mind that there's only not that there's only so much you can do, but that it doesn't always work and it doesn't they just have so much going on sometimes that you lose people to whatever they're doing.
It's neat, like you build like a rapport to where, let's say if they relapse and they don't automatically want to come and tell you, they will come in and give you their whole story of why they didn't come in. Like it's nice to know that you built that rapport, that they're comfortable in sharing that, but it's also a really good thing to know, like regardless if they relapse, like they have a safe place to go. I always tell my clients, I don't care if you're high, I don't care if you're in a crisis. Once you're in my lobby, I know you're safe and then we can go from there. So it's once you build that rapport with the clients, they will always come back. So you can be worrying, but you got to step back, but they always, come through in some ways, or a partnering agency will call you that they made contact with that client. So then you can go intervene and start that treatment plan once again.
I think a burnout comes a lot when we feel like we're not being effective or we're not making a difference. And I try to take a bigger view of things. Like there's so much more mental health help now than previous generations or whatever. And that might go up and down, but I'm there trying to help this person, and that builds over time. Some people I help, some I don't, but I'm there trying to help somebody, and that helps me kind of keep going, I guess, and not get too frustrated or feel like the world's falling apart or something like that. Yeah.
Is there a time when you decide like this person will no longer get services? Because like you said, like they stop coming and then they come back and then they stop coming and then
I mean, not like that, but I guess sometimes we have to stop if they're a danger to the center or something like that. But we're the local mental health authority. We don't say you've had your chance. Sorry. There's not a limit to what they can get from us. Again, unless they're throwing rocks through our windows or something like that.
Yeah.
Which we've had.
But a lot of too, sometimes like we have grant funded programs too, where there is only one enrollment a fiscal year. So it comes into that community engagement. Let's say if they come in, they're just not making their appointments. Your grant says that you have to discharge them over 4 different no-shows. At least you always give them that resources that they need because you have community partners. So that does happen. It's just depending on what program you oversee or you work for.
Yeah, it's true.
Yeah, I was like, I'm gonna answer on the technical side of things.
Yeah.
Technical.
You have to follow grants,
Mhm.
things like that.
Beautiful thing.
Any other questions? All right, well, thank y'all so much.
Thank y'all so much for all your help this morning. And I'm sorry I missed most of it. I was having to get things ready for the later presentations, but really appreciate it. I'm gonna go watch it in the recording. So remember, this will be recorded and it will be posted on our Tex-CHIP website and on our YouTube channel. Okay? And so we're gonna take a 15-minute break, and then after that, we'll
Sign
come
it
back and
and say
Dr.
that.
Leeth will begin his training.
Just get started on. Is this still?
There we go.
Both of them were on.
Yay, okay.
What a rush.
All right, everyone, we're about to get started.
All right. So thank you all for having me. I see very few, but still new faces. I'm Dr. Leeth. I'm one of the faculty in the Counseling and Educational Psychology Department. And I've been practicing for about 16 or 17 years. And so I've gone through different theories as I've gone through my own kind of counselor identity and skill development stuff, as all of you will. And probably since about 2017, I've been doing acceptance and commitment therapy. And I use that a lot in conjunction with emotion focused therapy, but I often come back to this and the layout because I feel like it gives a good layout. It helps with treatment planning and case conceptualization and things like that. And the really neat thing is that this is something that you can apply to your own life. So even as we go through this, I encourage you to kind of think and reflect on yourself and how some of these things might apply. So before we kind of dive in, what do y'all know about acceptance and commitment therapy? Yeah, Trevor.
I mean, the hexaflex model,
Mhm.
like the 6 parts, and you got contact with the present moment, committing to action, cognitive diffusion, acceptance, values. I'm forgetting, I think I just named 5. I'm forgetting self-context.
There you go.
Got the other parts, I think it's more like an octagon or like a nonagon. You know, you got like experiential avoidance.
Mhm.
And you got choice point, you got all that stuff.
Yeah. Yeah, very good. What else? That's pretty much it. Psychological flexibility. Yeah, that's it. I mean, that's the whole presentation. So we'll go through what is ACT, the goals of ACT, psychological flexibility, the processes, applying it to integrated behavioral health, case conceptualization, cultural, and then limitations. So ACT is what's considered a third wave cognitive therapy, right? It's third wave just meaning like historically it is newer. And the two big names are Steve Hayes and Russ Harris. Steve Hayes is the creator of it. He kind of developed it. Russ Harris is a practitioner that uses it. Steve Hayes is at University of Nevada at Reno. And they both do a lot with it. Steve Hayes tends to be more researchy, and he has a lab and he does all that. So a lot of empirical stuff for it. Russ Harris is very much a practitioner and very client centric. So if you wanted to know more, like, or you're struggling with a concept, Russ Harris is probably the place to go. If you want more technical information, Steve Hayes is the place to go. Russ Harris has a YouTube channel where he just kind of churns out very short videos that are intended for clients, but it benefits us in the sense that we can use that as a resource, but it also helps explain things. So if you are like me and sometimes just have a hard time articulating an idea, it might be worthwhile to look at it. And I'm going to go over relational frame theory in a minute. If you only had like a second or two to kind of explain ACT, it is kind of an integration of CBT and existentialism, right? It is a very cognitive thing. They include emotions in that, and that's important to hold on to. It is not only thoughts. And the existential part is that there's meaning making and values, and things are beyond our control. And so when we talk about ACT, we're thinking about what's going on internally and then within the broader context of a person's life. And psychological flexibility is the ability to withstand discomfort while moving in the direction of your chosen values, right? So not everything is easy. And sometimes you start on a task, you find out it's really difficult and you kind of quit. And that's okay. Like we all do that. Other times it's really important to you and you persist despite the discomforts, right? And that's what psychological flexibility is. There are those people though, such as our clients, who they want to do something, they truly want it. Like I want a relationship, but I'm so afraid of getting hurt. I'm afraid of closeness and things like that. And so when it starts getting serious, I'll leave, right? So not being flexible enough to roll with that discomfort is preventing them from getting something that is otherwise really important to them. So Steve Hayes, he has like the de facto books on it. There's no way you're going to read something that he does not come up with. He also does a lot of really good trainings. I know there's a few of you that you just heard this the other. Okay. So Steve Hayes had tinnitus or has tinnitus, and what he found, right, the constant, for those who don't know, the constant ringing in your ears, it's very distracting, it's very frustrating. It doesn't go away though. And so no amount of thought stopping or thought challenging is going to go away. Minimizing would be invalidating. Like, is it that bad? Right? Could you imagine having kind of a chronic condition and someone doing the, well, it could be worse, right? How invalidating. And so that was not the solution for him. And from that, he started thinking, well, this thing is driving me nuts. It is preventing me from work. It is preventing me from leisure, from my relationships, because he was so distracted with the frustration of it. He just couldn't stop thinking about it. Right? So for example, someone might say, do you want to go see a movie? And his immediate reaction is, what's the point? Right? I'm going to be distracted with, I'm not going to pay attention. So it was preventing him from doing the things he wanted to do. He eventually landed on, I have to find a way to be okay having it because it's not going to be there. I'm also never going to like it, right? And so that's kind of one thing I really want you to hold on to through this is that acceptance in this context does not mean that you like it, right? You can, of course he wishes it was gone or that it was never there, but he wants to have the life he wants to have despite having this constant discomfort. Russ Harris was a physician. He's in Australia now. He's from the UK. And he came from a family of physicians. And it was one of those kind of stories where everybody went to medical school. So you're going to go to medical school also. And he really didn't want to do it. He did it anyway. It was a drag, very difficult. He became a physician, didn't like it, and had a really unhealthy lifestyle, right? He was depressed, he was physically unhealthy and very young, and he just was miserable. And part of it was, I'm in this life and this lifestyle that I don't want. And he saw some self-help books, of which one of them was Steve Hayes and acceptance and commitment therapy. And it really changed the way he looked at things. And then with his patients, he started using those ACT techniques. And so he slowly started shifting from medicine to mental health. And this is just like a really big part of his life. And so he advocates for it a lot. So third wave, right? And this is just kind of, again, history stuff. That includes our behavior therapy, our CBTs, and then what they call functional contextualism. And so I'm going to go over this a little bit more in a second, but CBT at this point, like so 60s-ish, 70s, worked conditionally. It worked for some people, but not all people. And part of it was the context that people live in, right? There are contexts where fear is appropriate, right? To keep you safe. Or there are situations where anger or grief or whatever is there. And so really what they kind of figured out was the context matter. Thoughts are not inherently good or bad. And neither are our feelings. They just are. And sometimes they fit the situation and sometimes they don't. But it really kind of depends on the context. So take, for example, I think most of you, if not all of you, have probably taken psychodiagnosis. Yeah. So think of like depression. In what case might someone look like they're having a depressive episode, but they're not? What's a time when someone might be really sad, but we wouldn't want to diagnose? When they're grieving, right? So someone says, oh my God, I can't eat, I can't sleep, I'm sad all the time, I'm hopeless, nothing's gonna change. And then they say, a parent passed away a week or two ago. Well, of course, we're not gonna then say that sounds like depression, we're gonna say that's grief, right? So that stuff depends on it. Somebody getting rejected, right? So I worked with a lot of college students who didn't always get the goal that they wanted, did not get accepted into grad school, into medical school, into law school, got kicked out. And they're frustrated. What am I going to do? And they feel hopeless and helpless. Right. That is a function, right? That's the functional part of the context that they're in. You were rejected, you had your hopes up, which you should, and it didn't work out. So initially, what it was is that we would encourage clients to put distance between them and their thoughts, right? And so this is a really important distinction. Let me see if I can move the window here. Oh. What they found is that not just focusing on changing the content of the thought, but putting space between you and that thought, right? Realizing I'm having this thought doesn't mean I need to act on it, right? Versus just challenging it, which would be kind of that traditional CBT approach. And I found that really helped with people with depression, right? They're able to say, yes, I feel depressed, but I don't have to act depressed. I feel depressed and I can get out of bed. I feel depressed and I can do the things I want to do, right? It's not ignoring it. It's just kind of realizing I'm having the thought, but I am not the thought. Initially, they were going to call it cognitive distancing therapy, but they felt that was too close to CBT. So the way these two things kind of combine, the CBT part is being aware of your thoughts and feelings. There's no getting around this, right? And so you would spend a tremendous amount of time at the beginning with your clients trying to get them to be aware, what thoughts are you having? What are you experiencing? You might even start with body stuff, right? For somebody who just is really uncomfortable thinking about that, like doing the grounding thing. What are 5 things you see, 4 things you hear? Tell me, you say you're stressed out, where on your body do you feel it, right? To get them aware of it. CBT usually follows that ABC model, which is what? Yeah, so antecedent, behavior, consequence. Focuses on the behaviors, that cognitive triangle, right? Behavior, thoughts, feelings. If you think bad, you feel bad. If you feel bad, you're going to behave in a certain way. If you keep doing harmful things, you're going to feel bad, and then you're going to think bad, and so on. Existential, the edgy of the theories, is for meaning making and having values. But the other big thing about it is that anxiety and despair and discomfort is a natural part of life, right? You will not have a life where you are completely pain-free, right? And that sounds really downerish. The idea, though, is that the pain is inevitable, but suffering is what? Yeah, is optional, right? And so if you keep fighting, right? So think of couples, I want the perfect relationship. And in their quest for it, they keep ruining their relationships rather than accepting there is not going to be a situation where it is completely perfect. And if you keep trying to avoid all discomfort, you're actually going to make things harder for yourself. Things might go wrong, right? And that's where all the internal chatter comes. What if I do this and I fail, right? What if I go and have a panic attack? Somebody wants to write a book. What if nobody reads it? I want to try out for this team. What if I don't get on it? And yes, that is a reality, right? It might not work, right? In fact, they have a whole book, right? Things might go terribly, horribly wrong, right? And it's the idea that if you keep ignoring that, rather than leaning into it, you will probably continue to not achieve your goals. CBT focuses a lot on cognitive distortions, right? The minimizing, catastrophizing, concrete thinking, all of that. And then if you do what the Becks want you to do, right, you go past the automatic thoughts to the intermediary ones. And then beneath that, we'd have the negative core beliefs. And really you're focusing on changing the thought, right? I'm challenging the thought. So here I am and I say, nobody likes me. Trevor says, well, what makes you think that? You have lots of friends. I've seen people talk to you. And so he's challenging, and that is not bad. This is not anti-CBT. With ACT, we're identifying that thought. So I think nobody likes me, and it's changing the relationship between me and the thought. So now, Trevor, rather than trying to challenge it, are you really unlikable? Who said you have to be perfect, right? Things like that. He's saying you are having that thought. What purpose does that thought serve for you? What is it trying to do? Is it helping you, or is it keeping you from doing things? So if I'm someone who feels like nobody likes me and nobody will like me, then you all invite me out to a party, and I already think you don't like me, I'm likely to not go, which then perpetuates, right? Because I don't learn that maybe people do like me. Eventually you will stop inviting me, and I'll say, I never get invited. If I go and I'm really in it, I might just say, oh, they invited me out of pity, right? Like if it's really strong. And so he's trying to change how I view that thought and how much influence I want it to have on my life. So let me stop there and kind of check in thoughts, questions, reactions. Making sense so far? All right. Oh, yeah.
I was just gonna say, I see the value of moving from changing the thought when, you know, in circumstances like this or when, you know, the thought is true. But you know,
Well, they do say, and this gets ignored, they do say, if there's a place where there is a truly errant thought, you should change it, right? Or if you can change it, and you think it'd be beneficial to do it, they are not anti-changing it. It's another way of doing it. So Hayes especially is okay with you challenging those thoughts. What we want to avoid is kind of getting into a back and forth. So now it's me and Trevor, and he's saying, well, you just told me that they invited you to this party. And I'm saying, yeah, because they pity me. And he's saying, well, why would they pity? And we're kind of doing this back and forth. And that is part of CBT. This is just another way around it that removes us from conflict is too strong a word, but maybe sort of this back and forth that can be there. Absolutely. If there is something, especially if there's kind of a thought disorder or something like that, you would try, then you would focus on the content. So it's not never focus on it. Does that kind of address your point? So contextualism. So this is sort of like the underpinning. And last year when I went over this, I kind of glossed over it. So I spent some time this year reviewing it, just to kind of add more context to it. So with contextualism, because remember, they call it functional contextualism. And this is not the meat of ACT. This is just sort of the foundation underneath it, right? So underpinnings. So they classify behavior as anything that's observable or knowable. So it's not literally behavior like an action. Behavior would also include your thoughts and your emotions. And context are the situations and the history that influence your behavior. So now you're kind of piecing together, yeah, if you grew up in a perfectionistic household where you had really rigid parents that demanded perfection from you, you will become an adult who what? Yeah, you become a perfectionist, right? So that's our history, and now you're in grad school and you're a perfectionist, so what do? Strive for perfection, yeah. Be relentless with it, be overly critical. So the thought that I have to be perfect, and then the feeling might be fear of not being perfect, or anger that I made a mistake. And then in that context, I do something to alleviate those thoughts. So our thought, if I'm not perfect, no one will like me. The I'm not perfect is the behavior, it's the thought. No one will like me, that's the context. So if someone said I have to be perfect, our follow-up question might be, why? Well, I want people to like me. I want to do well, right? And that's our context. And so rather than focusing on the content, like where did that thought come from? And these are all, again, so Victor's like, this is not an always and never situation. You can always say, where did that thought come from? But we're focusing on the function, right? What purpose does that thought serve? And so what we see with perfectionists is that they actually have incredibly high levels of disconnection and isolation, and crave connection with others more so than non-perfectionists. So they want that, but they feel that their acceptance, they'll only get connection if they're perfect, right? So people will only accept me if I'm perfect. So what thought or what purpose does the thought, I must be perfect, serve? In this context, what would that serve?
In order to get people to like and feel validated.
Yeah, so to get connection, that's why I'm having the thought. I have to be perfect, because that thought is kind of a means to an end. I want connection. The way I get connection is through being perfect. And so we don't need to focus on the form, right? The content. I need to be perfect. But changing its function, right? And so acknowledging that you have that thought, and ideally your client kind of arriving at it, that conclusion as well. That thought has a purpose. We don't need to kind of get into the back and forth of if it's wrong or valid or not. But if I can step away from the thought and just not immediately act on it, if I can see what it is external from myself, then maybe I can do something different, right? It's when I separate myself from it that I can look and say, you know, I guess that isn't the only way I can make friends. That's maybe not the only way to make connection. And relational frame theory, which is like, I'm not going to spend a whole lot of time on this one. So relational frames are just relationships between concepts, right? Bigger than, smaller than, the same as, different from. This is how we relate things. You do not have a choice in doing this process. And this process is found, like this comes out of like psychology of language. It starts when you're an infant. You're trying to make sense of the world. And as we piece all these different things together, we then have a map of how the world works. The problem becomes when there's sort of arbitrary relationships. What does that sound like, the term arbitrary relationships? Yeah. So for example, if I said, how are ice and snow similar? They're both cold. How is metal and stone similar? Okay. How are they different?
Magnetism.
Magnets, magic. What about a nickel and a dime? How are they the same? Coins, how are they different? One is worth more, and what's the other one?
Oh,
Yeah, you got the better one though. That was a higher order thought. So then, how are Fritos and this muffin the same? Lot of answers on the food one. So how are they different? There you go. Nice. Then you're pulling out the heavy stuff. muffin and pen?
Objects.
Objects. Okay. What about? Object is one, so no repeats. Muffin and rope. Solids, all right, that's the cousin of objects. Right, so we start finding stuff, and no matter, I'm willing to bet, no matter what combination of things I put up, you could find a relationship, right? I could say, how are they different, right? How is the rope and this muffin different? I mean, most people would just say you could eat the muffin, but you guys took the scenic route. Yeah, and so no matter what combination of objects, right, we can form some relationship, right? And it might be, how is one better? How is one worse? How is one bigger, smaller, different, the same as, similar to, whatever. And so when we apply this then to human life, to our lives, this extends to other things such as emotion and interactions and relationships, what we should be, what we ought to be. And this web of frames just serves for us to make sense of the world. And we all have one. They might be different, or not might, they probably are different based on the circumstances of your experience, right? How you experience the world. So, for example, let's take a child and he learns what cats are. Like that, cat. So he learns cat, C-A-T, pronounced cat, small, furry, snooty little thing. And then that cat scratches the child. It hurts and they cry. So what do they naturally kind of think in their childlike mind about cats? Cats are bad. Think of clowns. Exactly, right? We all have that in common, right? So clowns are scary, right? So mom says we're getting a cat. What is the child's reaction?
Fear.
Yeah. Mom, what are you doing? Yeah, so we're getting a cat. He has associated, right? So this is kind of that behavioral operant conditioning, right? We're just making relationships, right? Cats are small and furry. They're also hostile and aggressive, and I don't like them. My son, this is like a real life example. I did not experiment on him. He made his own choices. But we went to In-N-Out, and they have like the sports peppers, right? The little ones. I did not know that those are actually spicy. I thought they were like banana peppers. And so I said, yeah, knock yourself out, right? And he was like 5. And so he had a sport pepper. Dr. I said, okay, it's back. And so it was really spicy. So what relation did he draw about these peppers and eating? Not quite yet, but just between these two. It was hot. That sucked, right? Eating it burnt my mouth, right? Peppers are spicy. And then Anna, yeah, that foods that burn are called spicy. So now anytime the word spicy comes up, what does he think of? Yeah, peppers. And anytime I say something like, can you pass the pepper, right? What does he think? It's going to be spicy, right? So anything that has peppers or spicy, anything that's spicy is going to burn, but it also goes the other way. If I said, what burns your mouth? What will he say? Peppers, yeah. So we have sort of these bidirectional things. And so this is why this is important, will become evident in a second, but this happens explicitly, right? People tell you, don't eat raw chicken, you'll get sick. You now have, I would hope everybody already knew this is not groundbreaking. Raw chicken and sickness, right? Hot stove and burn, right? Some stuff is implicit though, So children or teens, when they start setting boundaries and Melanie tells me a secret and I don't really realize the importance, I maybe don't know what a secret really is or how important it is to Melanie. And I go and I share that information. Now Melanie is mad and not talking to me. What can I derive? Secrets are important around minimum. This was important to Melanie. This bothered me. Then what I might say is for everybody, if someone tells you a secret, don't share it, right? They might not be explicitly told to me, right? And so we have, it's implicit and we start forming these things. So why is all this important, right? Because, and I'm guilty of doing this. I kind of blew off the RFT part of it for a while too. And a lot of the ACT stuff kind of glosses over it. I do advocate you do not need to get hung up on this because I think it can turn a lot of people away. But this is the foundation, and it goes back to Trevor's earlier question. These frames serve as the rules that we follow throughout the world. So now my son, this was several years ago, and he's still going on about it. You let me eat it. And it's like, So now years later, he's kind of like, hey, is this a spicy pepper, right? I don't want to eat that, or I don't like spicy food. Years later, someone says, I'm going to tell you a secret, please don't tell anybody. I'm going to recall, yeah, I did that once and it worked out really badly. And so people then follow these rules, right? So again, with perfectionism, I learned even if mom and dad never said, you must be perfect or I will not love you. I gathered that information, maybe because when I came home with all A's, they took me out and they lauded on me and they were celebratory. And when I came home with a B, they just said, huh, how about that? And moved on, right? So I gather all this information and it forms the basis for how I'll maneuver through the world. So this is where the problem comes. Not all these things are bad, right? Some of those rules are really good. So we tell kids, like, don't talk to strangers, right? Or don't like, look, mom, there's a snake. Like, yeah, maybe don't go pet it, right? Those rules are good. Like, I don't want you petting any snake, not just that one, but all of them. So not all rules are bad. It's when there's an errant or a mistaken relationship, such as I have to be perfect or no one will love me, right? But the thing about people, and we have studies that show this, is that you will continue, this is kind of a human only trait. We will continue to follow a rule, even if it's not working, which is why people do the same thing, right? Over and over. So the perfectionist, it's draining, it's isolating. I'm not getting what I want, but I will not give it up, right? Because that's what we do. We follow rules, even if it's not helpful. And the reason that we do this is that it helps us problem solve. And this is something I say with clients. I encourage y'all to, if nothing else, use this with clients when doing that. Your brain tries to solve problems. It's doing it with the information it has, even if it's incorrect information. And your brain is just following the rules that it derived, but some of those rules may be arbitrary. Some of those rules may not be accurate. And some of those rules really are really restrictive. I can never have fun. I can never be vulnerable. I can never not be perfect. They can be judgy, right? So if I maybe break a rule or bend it, I'm really hard on myself. And rule-governed behavior rules out or blocks all other methods of decision-making, right? So this is talking about when somebody comes to see you, right? So someone will say, I have to be perfect. I have to go to medical school, like Russ Harris. I have to do this. It's not really what I want to do. So emotionally, I do not want to do this. I'm very uncomfortable. I'm miserable, but that's not the rule that's being followed. That information gets blocked out or ignored. And the only rule that is followed is you must go to medical school. You must do this. So think of things like gender roles, right? What are some rules that some people may have for gender or based on gender? Jobs, tell me more. Mm-hmm. Yeah, okay, right on. What else? Okay. Mm-hmm. Sure. What else? Those are the only gender role differences we have. Yeah. Mm-hmm. Yeah. Mm-hmm. Yeah. And so you can extrapolate this to other cultural variables, right? So think of like toxic masculinity. Right? Now, that's not the only thing that this applies to, where I will absolutely never budge on the definition of man or manliness or masculinity. And anything that gets near violating that rule needs to be repelled and repelled harshly, right? Even if it's at my expense, right? And so there's lots of rules like this. So I have to be, think of certain faiths, right? Where someone may misinterpret things or not understand that you don't have to be perfect to do these things. Relationships, this is the role of a boyfriend or girlfriend or a partner and partner. Parenting, right? Being the perfect parent or parenting style. And so there's all these rules, but even if they don't help us get towards our goal, we still follow them. This framing will dominate over all other sources of regulation. So between having our relational frames and poor contextual control, like the circumstances around us, we don't always have control of what's happening. We wind up having some problems. So let's look at panic attacks. Client says, I'll have a panic attack if I go to the store. And if we said, why? Right, well, I'll feel trapped. Right? So feeling trapped, so it's not the store, right? It's not HEB that causes the panic attack. It's what? Nope. Yep, the idea of being trapped, right? That feeling. So it's not that there's something with HEB that does it or any store. It's how you feel in the store. What is that feeling? This person says trapped. Well, where else might you feel that sensation? Large crowds, what else? Small rooms. A variety of places, right? Like it wouldn't just be the store. There would be lots of places where I could feel trapped. And so I won't go anywhere. Because anywhere I go, I will or might feel trapped, right? And so that's where our rules come from, right? That's a real life example. Another one that maybe some of you can apply to, and Dr. I's here, and so he teaches psychometrics, the psychometrics example. So I am not a math person, right? Anybody else? Yeah, shout out. Yeah, right. It's awful. That's why we have Dr. I to handle it. So we have language, our relational frame. Math is hard, right? Wordy things are easy or easier. Math has numbers, right? That makes sense to everybody. You know why I would say that? And numbers equal math. Psychometrics has numbers. So what does that mean? Psychometrics is hard. Psychometrics has numbers. Psychometrics is math. I'm not good at math or numbers. I'll struggle in psychometrics, except with Dr. I's help. And then I excel, right? So that's what happens. And so I'm parsing it out. And you might say, do people really think? No, nobody thinks like that. It doesn't go in that stepwise order. What does it do though? It's automatic, right? It's just implicit. So if in 2 slides, I have a bunch of tables with numbers, like a correlation table, and I have statistics, right? And I'm telling you, I'm preparing you now, I'm going to go over all these numbers, being real, and then I'll tell you what my reaction would be. What is your reaction going to be when you see that slide? It's scary. Shut down. Yeah, I think that's probably the most accurate one. Did you work through each of these thoughts? No, of course not. You just do, right? And that would be my reaction, right? So if someone presented a bunch of stuff I couldn't immediately understand, it's like, okay, I'm not going to get this, and I go to my happy place, right? I'm not a detail oriented person. So if Alicia, if I say, hey, how do I bake a cake? But she's really detailed, right? You got to get this flour. It's got to be organic, and it's got to be ethically sourced. And she's going through the whole thing. I guarantee you, I'll just be like, yeah. What will I take away from that? What is the only thing I'll take away? Something about flour, right? So yeah, we go through this because somewhere along the lines, I learned that managing a lot of, or not learned, I pieced together, having a lot of detail is overwhelming, right? And then I operate the same way with math and numbers. We see a bunch of numbers, right? It's tax season. And so you look at this thing, or if you see a bunch of numbers, you just immediately move away from it, like shutting down, like just sort of, okay, I'll wait for him to go to the next slide. That's a relational frame that I'm not going to understand it, or I'm not interested in it, or it's confusing but the thing is, without even giving it a chance, right? What if I had the perfect explanation for it, but you shut down, you weren't present while I was doing it? Then what happens? You don't learn it, right? So it perpetuates, you'll continue to think that's what it is. So what do, right? We have to kind of, one, step outside of that web, realize that we have all these things, right? Unhook, and these are things that we're gonna go over. Identify errant thoughts or mistaken ones, right? Such as, people only love me if I'm perfect. Avoid judging ourselves. And then for us as counselors, avoid judging them, right? There was one time, I'm gonna pick on Trevor because there was a pivotal moment in our relationship that I hold on to. I gave an example about a car, and I was being sarcastic. And I said, how many parts are in a car? Like 12? And even though I was being sarcastic, he was still disappointed in me. And you could see it all over him. That Trevor is the face of judgment, is what I'm saying. And so when we're in session and someone says, I had a client when I first started, I'm quoting verbatim, I have to make $1 million to be successful. And he said it so matter of fact, and I thought maybe it was a like hyperbole, like euphemism. Like I thought he meant I just need to make a lot of money. No, he meant literally 1 million was the threshold for success. And internally, my reaction was like, oh, son, like, no, like, you're not the one. and of course, like, as someone who wants to help, it's kind of like, that's a lot of pressure. Like your worth is tied to money. But the way he said it, just so matter of fact, made me, again, internally, like, why on earth are you thinking this way? Right now, if I express that and I show it, that's kind of a judgy thing. And now he's gonna still have the thought and then feel foolish for having it, right? So we don't want to beat ourselves up. That's shame. I'm so dumb for thinking this. And we don't want to judge others. So one of the activities that we do with ACT is imagine that you have a container, and in that are all of your relations, right? All your thoughts, all your frames, everything, all your rules about how the world works, right? And that contains everything, and that sort of makes sense, kind of CBT-ish, like here's my thoughts, right? We're externalizing it. But it doesn't stop there. In addition to having the container, we are also in the container with it. So when clients come to us, so prior to ACT, in other words, we are our thoughts, right? We don't see them separate from us. We're all in the same pot, right? They're in the same container. So most people don't think, and I didn't prior to learning about ACT, learn to separate yourself from the thoughts. We just act implicitly. So what we have to do then is remove ourselves, because we can't unlearn these things. Going back to what I said during the panel discussion, it doesn't ever, there's no process of unlearning. You can recognize it and you can minimize it. So gender roles, right? So I'll speak as a guy. One of the ones I grew up with was you can't be emotional, right? You're allowed to be happy and angry, and that's really about it, right? And then understanding that, no, that's not the case. I'd be a really awful counselor if I stuck to it, right? But that rule is still there. That relationship is still there. That masculinity is tied to a set of rules about emotional expression, but I have mitigated its effect, right? That relationship is still there. I can identify it as it's not always true, it's not healthy, and things like that, but it doesn't ever break. It's just kind of cemented there. So all of our thoughts, all of our frames stay, but we can remove ourselves, right? So I'm able to kind of set it down and view it separately from me. And if I'm able to kind of look at it, because remember, they serve as kind of like a map. And imagine if we lived in such a world where we had like technology where we could display the web, it'd be a very complex thing, right? If I could see how I've mapped out the world, what could I do with that information? Understand where they're coming from, and what else?
Put space.
Yeah, put space. And then with that, what could I do? Almost. Maybe. Everybody's kind of hovering around it.
Viewing them in a different.
Yes, I could do things differently. I could see, okay, that's where that's coming from. I don't want to do that. Right? So hypermasculine guys, especially teenage boys, right? So someone kind of threatens them, bumps into them. They then feel like I have to start a fight or get into a fight. Otherwise, I'm what? Yeah, I'm a wuss. I'm weak. And so I'll engage in this because that's what you're supposed to do if you're a boy, right? You can't be weak, so you gotta show them you're strong. But if I could see that, because then that person grows up to be an adult and does the same thing. But if I could see, I have this idea that if I don't immediately attack anybody that I even think has slighted me, then I'm weak. Well, that doesn't make a lot of sense. I don't want to do that. But it's really difficult if you're just kind of in it to see where that's coming from. So if I could see on a wall, you know, that meme with the guy with all the red string, right? The Pepe Silva one. If you could see, I guess I never realized the relationship I built between perfection and acceptance. I don't like that. In fact, I don't even really know that it's true. I don't want to do that anymore though. But until you separate it, you're going to keep doing it. And even once you separate it, I'm not suggesting it's like, oh, that's it. Oh, that's the end, right? You still have to go through the process of learning new rules, right? So thoughts, questions, I know that was a lot of, that's probably as technical for what it's worth. That's as technical as it's going to get. Yeah, Trevor.
I kind of had like a metaphor that came to mind, because I've kind of used it with clients
Mhm.
in terms of talking about all the different possible thoughts they could have, like, it's like a TV screen.
Yes.
And they're focused on one part of the screen. And it just made me think of like, whatever the thought is or the behavior that you're doing, it's like you're watching TV, but the thing on TV is like Cocoa Melon.
Yeah.
You don't have a remote. You only associate TV with like Cocoa Melon. It's like the only show that's on.
It's not a world I want.
Exactly. Then all of a sudden, you're given a remote, and then you can hit the back button, and then you're like on Netflix. You have like all these other shows to watch.
Yeah.
And so, and now you know it's TV. There's other things to view, other behaviors, and it's like, dang, okay, you can hit the home button too, and then now you got like Netflix, Hulu.
Yeah. Yeah, excellent. I love that. That's very apt. Yeah. Other thoughts or questions? What have you taken away from this last segment? Let me check in and make sure.
Yeah, I think for me, like when it comes to like relational frame theories, it seems like that's the way, I guess like the mechanism, how like
Mhm.
diffusion techniques kind of work, right? You're kind of like backtracking through those relational frame theories. Like the example with the cat, right? Like being afraid of cats. It's like, okay, well, some people like aren't afraid of cats, and cats are also soft. People take comfort being around soft things. So as you're taking
Did I offend you with my description of the cats? Which I'm just joking.
But yeah, it seemed like that's what kind of like the foundation.
Yeah, and that's exactly right. And so even Steve Hayes says, like in his foundational book, that Acceptance and Commitment Therapy, that RFT, like, know it, but you do not need to deep dive into it. It does this thing, it helps us further understand that we're not trying to change a rule. What's different is you can identify it, and then the person can make an owned decision to use or not use it. And the context matters, right? There are cats that are not dangerous, right? There are some cats that are very dangerous, right? So the context matters. So it's not ever to completely change the rule, but to pivot into a place of, does this apply or not? Does it have a purpose? Is it functional? And does it apply in the circumstance? Other takeaways? Yeah, Jess.
For me, I think reviewing the RFP helped me kind of break down even more so that activity triangle and ACT metrics that we talked about on Wednesday, like sometimes it can be overcomplicated.
Mhm.
Thought meets this action. So using the RFP to kind of even break that down even smaller for say like my population right now, adolescents. So kind of a big task to be like, what's the thought, what's the action, what's the need? When you can narrow it down to like, okay, let's just start even smaller, like what is that experience for you?
Yeah. No, thank you. Yes. Yeah. So I mean, if you're interested in it, pursue it. I also don't if it was kind of too overwhelming, which some of the like RFT stuff for me can be overwhelming. It is not a, I do not think it's a necessary component, right? I think even knowing less than what we've covered, you can still proceed with ACT. This just helps illustrate where some of those thoughts and rules were formed from, right? Okay, so what are the goals of ACT? So we did that, and again, those are just kind of like the underpinnings of it. Don't, ask clients, tell me about your relational frames, right? The big goal is to have a meaningful life while accepting the pain that comes with it. What do you think we mean by a meaningful life? Perfect, Molly. One that is aligned to your values. There is no universal definition of it. It's based on the client, right? And what's important to them. That's also the part where the cultural considerations come in, right? As opposed to saying something like with gender roles, right? Like in, I don't know, the 20s, 30s, 40s, when it's like women should stay home and have children and men should work, right? And so different generation, different value, right? Independence, right? Over kind of traditional or whatever the concept of a family was then. It's based on your personal experiences, your personal values, and then cultural stuff. A smaller goal, how we get to that big goal, is acceptance of unwanted private experiences, and that's kind of a key word for ACT, in committed action towards living a valued life, like Yanni said. So, what are private experiences? I'm sorry? Yes, and yeah, that works. It goes in there.
Getting cut off. Exiting the highway like damn near every day.
Yeah. So your private experiences are, it's all the internal stuff, right? It's your thoughts and your emotions. And I don't know why my slides are out of order. The internal chatter, right? So these are the thoughts. Cognitive distortions, this is the end of the world, this is the worst thing, no one will like me. Painful memories, so rumination, right? Where I'm just constantly dwelling on something, right? So maybe I got into an argument with my partner and I stay up all night thinking about it. It's the next day and I'm still thinking about it. Anybody like have those like 4 a.m. thoughts of like something you did like when you're in 6th grade? Yeah, it's internal chatter, right? Worrying about the future. And then your emotional experiences are the feelings, right? The emotions and the discomfort. And so when discomfort comes, we try and avoid it. And so this is an important distinction with ACT, is that it's not so much that you are trying to mitigate, like in the case of a panic attack in stores, you're not trying to avoid stores in and of themselves. What are you trying to avoid? Feeling of being trapped. Right, exactly. And so I will try to avoid. So take the case example that we had earlier with Jill. What did she do to mitigate her uncomfortable thoughts about her abuse? Drugs, yeah. So completely normal. This happens, right? And so you might turn to drugs and alcohol. You might just turn to going to the gym all the time. You might turn to shopping. You might just try to start up another conversation. People turn to work, right? They throw themselves into their work because it gets me out of thinking about this. And if I get out of thinking about this, I get out of feeling this, right? So, and it happens. That's why we have people who overwork, for example. One of my clients, what she'll do is when she and her husband get into an argument, she'll throw herself into her job and she does exquisite work, right? She gets all sorts of accolades and promotions and stuff like that. And at surface look, it seems like, oh, your job's really important to you, or that you're really good at it, or you value success. And while maybe parts of that are true, the bigger part of it is she and her husband are constantly in conflict. So what does that mean? She's constantly what? To manage the feelings. Going to work, right? So if you fight with your partner 7 days a week, then you're working 7 days a week because that's how she's managing it. While she's at work though, or working on whatever, what's happening with the conflict between her and her husband? Yeah, at a minimum, it just stays the same. More than likely though, what's happening? It's getting worse, right? What might her husband be saying? No, probably not that. Because I would take there probably is some partner that says that's a lot of insight, though. You're saying that because you're thinking as a counselor. What is he saying? You care more about your job than you care about me. Yeah. And so that makes her feel worse. So what does she do in response to that? Works more, right? And so it perpetuates. So that's what we mean by avoidance. Another form of avoidance, I'm saying this next, I can't remember if I have a slide on it, is it's not literally let me kind of like turn away from it. It might be that I try to control it, right? So in the case of like perfectionism, I keep using perfectionism because it's my research area. Perfectionism, I'll only do things that I know I can be perfect at, right? So I move to a new town, I make new friends, and they say, hey, let's go bowling. It's not even that I don't know how to do it. I just don't think I'm going to be the best at it. So I'll say no and really urge, let's go shoot pool because I'm really good at that, right? But I'm going to do this every time, right? So now here, let's go fishing. Let's go play basketball. Let's go do whatever. And I'm going to keep declining and only accept the things that I can excel at. I'm avoiding the discomfort of being imperfect or being flawed by trying to control the situation, right? I'm trying to control, like with body image stuff, people who have like this really rigid eating style or really rigid diet behavior are doing it to avoid, I don't want to look a certain way. Social anxiety is literally, I'll only go to these areas during this time because then nobody's there. So it's avoidance through control. It's not completely just trying to shut it out. You might engage in the world in this very controlled manner. So the way that we manage our private experiences is through psychological flexibility. And the example that they give is, and this is where we go full circle to the existential part, there is going to be discomfort. Think about it, y'all are in grad school. Kelsey and Lena are in a doc program. Some of you have jobs and children and other responsibilities, and it's really difficult. And yet you're not surprised by the difficulty, right? You're kind of like, yeah, that it is hard, it is tiring, and I'm doing it. And you don't fight it because it's to be expected. That's what happens. Exams are stressful, giving presentations is nerve-wracking, and you do it anyway. You're not really surprised, even though there's maybe a little bit, for some of you, it's very little, for some of you, it's more. That's what they call clean discomfort, right? It's the acceptance of, okay, I know that this is nerve-wracking. Even when I give presentations, and I've done this for a very long time, and on topics I'm pretty knowledgeable about, and you know, the 15 minutes before, I still get myself really amped up, and then I just shotgun an energy drink, and I'm like, let's go, you know. And so you roll with it versus, you know, you might cancel at the last minute, right? Or don't apply, right? Don't submit anything, or you know, just don't allow questions, or you do a bad job, or limit things. And that's what they call dirty discomfort. I had Googled like dirty dishes and it was super gross. So I just went apart. I was avoiding. And so that's dirty discomfort is, look, we are not only responding to the situation, but our reaction is even worse, or I shouldn't say worse, it compounds the situation, it makes it worse, right? So it's taking something to be expected, but in my effort to control it or avoid it, I'm actually making a bigger mess, right? So you know that you need to address something, like take a relationship thing. Someone says, I mean, I feel anxiety just saying it. Can we talk? Yeah, you guys get it. And so you say, yeah, later. And then later comes, and what do? Yeah, you keep avoiding it. And so if I said, listen, now it's like 6 days later, and I'm like, hey, are we gonna talk or not? What's my experience as the other person? I'm starting to feel what? Yeah, I'm starting to feel, you said abandoned, which I think is great. I'm starting to get impatient. I feel abandoned. I feel blown off. And so now I'm getting to the point where I'm starting to get really upset, right? And whereas I may have just said, look, I wish that you would let me know when you're, coming home late, or I wish you would, clean up after yourself, even if it's not a romantic thing. What if it's like a roommate thing? I wish you would clean up the kitchen when you're done, things like that. Because you keep blowing me off, now I'm upset at you because you keep blowing me off, and on top of whatever I want to talk to you about, right? So that's part of it. The other part of it is, what are you doing to yourself? Because you know that I want to talk to you. And so you keep putting space between me and you. What does that do for you or to you? Yeah, it isolates and it kind of prolongs that anxiety, doesn't it? Like, yeah, the conversation might suck if I'm like, look, you're a nasty roommate, like clean up. But you maybe even have a good idea, but you keep putting off the conversation. You know it's coming. It's kind of like putting off studying or doing a project or whatever it might be. And you know it's going to be there. It's not going away. So that's what we mean between pain is inevitable. This conversation is going to happen at some point. You are going to take the midterm or final at some point. You will have to do whatever, but the more you keep avoiding it, the more you're just prolonging your own suffering, right? Because you still have to carry with you, I got to get this done, right? And that's where they give the example. And these are all, like, ACT is a very metaphor heavy approach. The struggle switch, which you all know Dr. Ricard. Yeah, like he's an ACT person. He's not as good as me, so don't ask him. But like he will do this like when he sees me stressed out, like, is your struggle switch on? It's like, nah, please. So then I switched it to something like newer instead of like the light switch. So when it's on, this is where like we're kind of berating ourselves, right? So now it's the night before the psychometrics exam, and you're like, oh my God, numbers, and I've only got 6 hours to study. And so why do I do this to myself? Here I am again, right? Relationships. Why do I always get into the same relationships? Why do I always do the same thing? Why do I always think things will be different? Whatever it might be, right? You're kind of beating yourself up about it, right? I shouldn't be upset. There are people who have it worse. And like, yeah, maybe that doesn't make it less sucky for you. It just means there are other people that have different things. You stare quietly into the void, right? Which is what I do. Just sit on the edge of your bed for like 20 minutes, just like, this is really happening, huh? When we turn off our struggle switch, then we acknowledge discomfort, right? Like, I'm frustrated, right? I can do what I want with this energy. My son, the one with the peppers, his birthday was on Wednesday. You guys can just Venmo me whatever gift. And I came home and I think I was frustrated with either like traffic or something fairly benign. And it's his birthday and he's turning 13, so he's now a teenager. And so he's really excited. So it's like, I don't want to act frustrated on his birthday, right? I want him to enjoy it and I want to enjoy it, right? So is there a way for me to manage this without sort of saying, why are you doing this? You're ruining his birthday. It's only going to happen once, and like really kind of beating myself up. It's saying I am frustrated. I don't want to take away from his birthday. I want to celebrate with him and I want him to have a good time. While my struggle switch is on, that's when I'm kind of like trying to fight both things. I'm trying to be present and deal with the discomfort. And I'm also blaming myself, like, of all days, I have to get frustrated on his birthday, right? And so really making myself feel bad for feeling bad, right? Can anybody kind of relate to that? Feeling bad for feeling bad? Yeah, it's a common thing. So you're willing to experience it. And what that looks like, so it doesn't sound super heady, is just literally acknowledging, I am frustrated. and I don't want to deal with it right now. Or I don't want to take away from what I want to do. And then the reverse might be true. It might be a problem that's big enough that you're like, I have to address it first. Right. Again, and that's kind of like one of the beauties of this is that there's no right or wrong. It's just, is this helping you do what you want to do? It could have been someone else could have experienced and said, I need to go address this problem and then enjoy the birthday party. Because that works better for them. Right. The idea though is that you have to kind of acknowledge it, not beat yourself up about it, not minimize it, and just say, like, yes, I'm upset about this. Would everybody be upset about it? I don't know. Doesn't really matter. Like when you're in a session with a client, I don't care about other people. I only care about you. If it bothered you, it bothered you. Like that is enough. Could you imagine if we did it based on everybody else? Like, does anybody know what percentage of the population has anorexia? And like nobody doubts anorexia is a problem, right? 1% of the population has anorexia. But we would never say to a client, not many people have this, right? It's only you, right? Or everybody else is happy. That guy had it worse, right? So we're just focused on them. If something is a problem for them, that's a problem for them, right? Maybe it wouldn't be a problem for us, but it is for them. And so that's what we'll focus on. All right, so let me check in and then let's take a break. Thoughts, questions? Everything making sense so far? All right, let's take a break and then we're gonna transition into doing act, all right? So I don't know, 10 minutes? Oh, we'll round it up to 12 because I spoil y'all. 13 minutes. No, not yet. I'm dying though for it. I'm gonna get on my PlayStation.
Got you.
Yeah, you have you done it?
No, because I still just have a Switch and
Mhm.
I haven't even opened up Rise yet.
Nice, all right.
But I did finally beat Persona 5.
I was gonna ask you.
Beat that during winter break.
Dang, the last time we spoke about it was summer one.
Yeah. Yeah. Well, I started it like fall of 2022.
Oh my
It
god.
ended up being 195 hours.
Nice.
To beat it. And like I said, the last boss, like the last villain, the final villain is hilarious.
I love it. I'm trying to think since the last time we caught up, what have I done? My son and I played through almost all of the Resident Evil remakes. We just didn't do
Are those
4.
really good?
Yeah, and so that was cool doing it with him. He hadn't seen them.
Mhm.
And then I think we played through the Dead Space remake. We did a lot of survival
How was
horror.
that? Yeah, it sounds yeah.
It was good. I enjoyed it. I played the originals.
I only
And-
played the second and the third, and I remember renting the second one from Blockbuster
Yeah.
like on a weekend when my parents were out of town. And yeah, and I just remember those one dudes at the end of the game where you can't kill them. You
Yeah.
have to, like run past them, they keep regenerating.
Yeah, I think I know what you're talking about. Yeah. And so we did that, and then I think I haven't really found the next thing. So I've been doing a lot of like I've been playing Core Keeper,
Okay.
which is like it's just one of those open world crafting survival.
Okay.
Like it's very light. It's like Stardew Valley in the sense that you are setting up a base and stuff like that. There's no relationship forming or anything,
Okay.
but it does have a lot of combat and bosses. And
Okay.
so, you're finding loot so you can go further to get better loot to
Okay.
go further.
Yeah.
And that, and that's,
Yeah.
that has, I don't know why, but my wife was like, I've not seen you be into something like this for a while.
Yeah.
It's a good palate cleanser.
Yeah. So yeah, I could see that. I did start Fire Emblem Engage. I guess the next big game or the big game before I played Persona 5. Let's see, it was like Metroid Dread, and then it was
Mhm.
Fire Emblem. Which
Right.
I told you about that one.
Yeah.
And so after I beat Persona, I was like, all right, well, I definitely want to play Engage. It's been out for like almost 2 years now. So
Yeah.
so I'm about like halfway through that one. The story is just garbage. It's hot trash, but the gameplay is so good.
Yeah.
I love it. I love it.
It's not related to Three Houses. It's
No.
it's a
It is a
standalone.
standalone. They do, honestly, it was supposed to be like an anniversary game. Instead of these things, it's like little rings that you put on,
Mhm.
that, like embody pretty much like protagonists from like the past games. So it has like the main character that you play as just
Mhm.
Three Houses. And
Oh, really?
it's like a ring, you get some of their abilities. So
Nice.
that's really it. That's really, but yeah, the gameplay is great, the UI is great. But yeah, really digging just
Just the
the
gameplay.
strategy stuff.
Mhm.
I love it because instead of like, you know, you do like a boss battle, right? You have like these crazy set pieces. Is like, you know, you're setting that up. You walk up on like,
Yeah.
some enemy that's like over leveled. Then you get like, it's a 60% chance to hit, but it's like 35% like critical hit chance. And it'll show you like, yo, if you miss the attack, like the other dude's got like 100% chance.
Mhm.
It's gonna kill his character, and it's like permadeath.
Yeah.
And so, dude, just like landing a crit right there, you see like the crit
Yeah.
animation, like just adds to like
The rush.
the nuance of it.
Yeah.
Which is cool. It's like those moments.
Nice. I like it.
It's pretty neat. Now, just all the different classes.
Mhm. Yeah.
It's pretty dope.
Good. All right. I'll keep it in mind, like,
Yeah.
because of the story thing, not to get my hopes
Yeah.
up.
But Three Houses story in that one. Is
Yeah.
great.
Yeah, you were
That one-
telling me.
That one's much better. Then I think they're working on a new one too. That's like gonna come out like whenever the Switch 2.
Yeah.
is.
I mean, yeah.
I do want to get into Xenoblade though. That might be,
Mhm.
I've been thinking about, all right, do I want to do Monster Hunter Rise next or put that off and get into Xenoblade?
Yeah, because that's another one of those like time sink. Yeah.
Yeah, I've seen that. Yeah, I've heard about that. I heard
Yeah.
it's really good. It looks
I mean,
interesting.
I've always heard good things. I mean, they put the main character in Smash Bros. So
Yeah.
I mean, that says something.
Yeah, for sure.
You know, other game, I don't know that. I'm trying to remember when it would have been, but I played through. I 100%ed Lies of P.
Oh, okay, that's like a soul.
Yeah.
Right.
And I keep telling myself I'm not going to do any more Soulsborns because it's like it can be difficult to the point of not being fun. And then
Yeah.
I keep like winding up getting like another one. So
Okay.
yeah, and so but my son and I did that one, and that one was satisfying in the sense that, you know, there was no cheating, there was no easy way to do it. It was just you have to do it. And so it was I think that may have been, no, I did other ones. That was definitely the hardest one I've done.
Okay. So even like compared to Elden Ring, so
Probably not as difficult. I haven't done Elden Ring,
Okay.
but like I played Elden Ring for like half an hour and like gave up. Just like
Yeah.
it's still on my to-do list, but I was like, I am not ready
yeah.
for this. No, it's easy. You know why? Because on Lies of P, it's less open world. It is very much kind of go this way. Yeah.
Gotcha. So more like the other like Souls games.
Yeah. You know,
A little bit more than-
you don't have a tremendous number of paths to go, and even if you do, it'll dead end or loop back.
Yeah.
So you are not free like Breath of the Wild or Elden Ring style.
Gotcha.
So it is easier in that there's not a whole lot of guesswork.
Okay, and that's nice. That's good in those games. So like I said, I haven't played Elden Ring yet.
Yeah.
So I don't know what it's like in that open world sense, but I played Dark Souls 3 and 2 a ton.
Yeah.
Yeah, knowing, all right, this is the way to go. I know that like the little hidden items, like gonna be on these paths.
Yeah.
So that was nice. That made finding that stuff easier.
Yeah, for sure.
It's a crazy hunt.
Yeah.
Glitch through some random wall. It's like the invisible chest in Skyrim. Just
Yeah.
trying to find that.
Yeah. I've heard. Oof. Good. You doing okay otherwise?
Yeah.
Confident.
Yeah, it's been, I would say this semester started out like, it was like a treadmill, got set at like max speed,
Hmm.
and then I just had to like jump on it and then try to match that pace.
Yeah.
That's kind of been a good metaphor.
Wonderful.
It's had moments where it's slowed down, and then there's like weeks where it's
Going.
like this week. It's like family night out last night,
Mhm.
training, and then my last case presentations.
Nice.
So I'm trying to get that taken care of.
Right on.
So I got a lot this weekend, but
Man.
we get it done, and then it will be done. It's the final one. So
Nice. Good. Nice. Good.
Yeah, but I've been using Subway Theory's been really coming together. I've been like blending narrative and act, and I really like it. And the
Nice.
case I'm gonna present, it's like a good blend.
Good. Nice.
That's been pretty sick.
Good.
Had some good moments. Yeah.
I'm sure, I have no doubt. Good. I'm proud of you.
Yeah. Thanks. Appreciate it.
turning it on, making it happen.
Yep, totally. So yeah, it's exciting. Still feels like there's a ton of stuff to do, like in the short amount of time. Like
That's normal.
transition to career mode.
Mm-hmm.
Ready-
I
ready to
know
stop working. And I'm ready to retire from ABA too. I'm ready.
Are you still doing?
Still doing that.
Really?
Actually, the center that I'm at, my boss, she's a music therapist too.
Mhm.
So she had like a position created for her at Driscoll.
Mm-hmm.
Saying she's just gonna like close down the ABA side of things
And go there.
and go there. And because one of my other coworkers, she's leaving, she's gonna become an OT. So it's really just me and one other coworker.
Mm-hmm.
So a lot of our kids have already left, like this semester, try to find other centers.
Yeah.
And so really the only clients we have left are all like 10-year-olds. There's no
Woof.
closest take 10-year-olds.
Really? Ooh, that's good to know.
Yeah. So it's been that.
Yeah. So you are staying busy.
Yeah.
Well, I mean, if there's anything I can do, let me know.
Sure.
Okay.
We'll do. Totally.
You're doing all the right things. Doesn't make it less stressful.
Yeah. No, that's reassuring to hear.
No, yeah, you got it.
I see that too. Man. That's the 270 in that one, bro.
Yeah.
Yeah, that's the Celsius. That's the Celsius, right?
Yeah.
Yeah, that's the jacked up version.
That's what I
That's the
need.
amped up.
The second one today.
Bro, what?
I had rainstorm and then this one. Nothing. I'm numb. I'm done.
It's different. Yeah.
All right. So now we move into the ACT processes. And so these are what I was talking about, the hexaflex, right? So if you Google ACT, you will see these things. And going back, an activity that we do, and I think it's in the ACT for Trauma book, what we can do with clients is explain to them that your brain, your mind is trying to keep you safe, right? And it's not only keeping you safe from like physical danger, like stay away from fire or out of dark places and things like that. It's also trying to protect you from uncomfortable thoughts and feelings, such as shame, right? And so the thing is that it's really bad at solving emotional problems. It tends to overplay things, right? And it is trying to convince you that there's danger when there really isn't. So I'm gonna ask for a volunteer in Destiny. And so if I'm Destiny's brain, right? This is me trying to pull her over the anxiety threat, right? And the closer I can get her to pull, I'm telling her there's danger, right? Are you really trying, Bob? And so I'm gonna pull her, right? But I'm also really good. She can resist and she's doing well. She's like, okay, I don't need to go there. I don't need to think about what I did in 4th grade, right? And so she lets go, right? And so I'm really good. So I might try something different. So she just took it again, right? And then she realizes, oh, I'm there. So she lets go. And then I'm gonna keep trying this time for real. And you did it again, right? You keep taking the bait, right? And so she lets go again. And then I will keep trying and trying and trying, even though. And see, but at least this time you questioned it, right? She did it again. This time there was some hesitancy, right? But then if we switch places, here, you come over here, and then and we'll keep going. So she did. So I'm really good at convincing her that there's anxiety. I'm trying to rope her in. Now I'm not doing it because she's wrong, or because she there's any kind of distortion. She picked up either through experience, like maybe she did try out for something, didn't work out, and she felt really embarrassed. So now that's how it's always going to be. So here I am saying, do you remember that time that you tried out for that thing and you didn't get it? You don't want that to happen again. You know, oh, you caught it. There you go. Very good. Yeah. And so your brain is not trying to trick you. It's obviously not against you. What I'm doing as her brain is trying to protect her from the feeling she had when she didn't make the team, right? And that would never happen, you make every team, right? And so, but think of other times. It might be, I asked somebody out on a date and I got rejected. And the way it looked, so with Destiny, if she tried for something, what's something said, band, right? You didn't quite make, were you in band? And so she tries out for band. And she doesn't get it. And let's say the band director was actually really, really cool about it, right? You did so good. And maybe it's not, we just have enough saxophone players. Okay, but we're gonna respond. nothing shameful in that, but she felt it anyway, right? We're not gonna get into, what did he say? Why was that so problematic? You could if you wanted, right? But really, if you're gonna follow Act all the way, it's just that she's saying, I tried it and it felt really bad to not get it. And I don't want, as her brain, so separate from Destiny, the person, as her brain, I'm saying, you don't ever want to feel that again, right? That was awful, right? And so now she's saying, I'm gonna apply to grad school, which you did, and you got in. Congratulations. As did all of you, congratulations. And so you're gonna apply for something, right? So let's go back to your undergrad, you decide you're gonna apply to grad school. You're applying, do you remember what it was like when you didn't get on band? Do you want that to happen again? Are you sure? Right, excellent, you figured it out, see, that works. So thank you, Dustin, you did fantastic holding the rope. And so the important thing is, like, and this keeps us out of shaming, right? That to give it the idea of why do I have these thoughts is simply because out of self-preservation, I don't want to experience those things, right? There are people, you know, what's one of the, like, doom scrolling, right? Where I'm reading and stuff like that. We're doing that and it's really confusing because on one hand, you want to be informed, and on the other hand, it pulls you down. And sometimes people get to a point of, I don't want to watch this anymore because it frustrates me. I used to watch a lot of trash TV, right? Like the Real Housewives, like whatever. And then they started getting really obnoxious and I was like, I can't, the agita is too great. Like, you know, it's so obnoxious. And I found myself getting really agitated. And so then I just, like, no one says I have to watch it. Like my wife sometimes, but like, then I just go in another room, right? And so we're paying attention to the stuff we like and we don't like. Our brains are designed to just keep us safe. And it makes these rules. So in Destiny, she tried for band. She got, I'm not gonna say rejected, she got denied. In her head, it was a couple different things. I tried and I didn't get it. Not getting it really hurt. I can get hurt if I try and don't get something. And as her brain, to keep her safe, I'm just like, look, you don't need to go to grad school. Don't do it. It's scary, right? But she really wants to. And so do you see, that's the dilemma, right? The way she's managing her discomfort by avoiding applying to grad school also keeps her from doing the thing that she actually wants to do. Does that make sense? So relationships, right? So you work with a single person, you're doing individual counseling, and they tell you, oh, I just want a relationship. I just need to find my person and all that. And they tell you, I started dating someone, it's going really well, then things get serious, and then they abandon ship, right? Because maybe they're not used to that level of vulnerability, that level of commitment. It reminds them of the last time I got to this point in a relationship, somebody hurt me. And so on the one hand, I really want this relationship. And on the other hand, I really want to avoid discomfort. And when we kind of give in, then we're putting off getting the things that we want. So through these processes, we help figure out what they want to do and how they can manage discomfort. So this is the Hexaflex, and I know it looks very busy. It's just the 6 things, and all you have to take away is that each one of the 6 affects the other 5, right? And in comparison, we have the Inflexihex. This is the bad one. I labeled it as bad, so there's no confusion. So here, we can have inflexible attention. Right, so you're in psychometrics and you're thinking about the time you took algebra and you failed, or the math teacher that was like really awful or something like that. And here's wonderful Dr. I, like teaching his little heart out, right? Doing a great job, but you're so fixated on recalling the past. You're there. Or maybe it's not even anything related to numbers. Maybe you're just thinking about the argument you had the night before, or that you're worried about an interview that didn't go well. But you're either focused on something that has already happened or something that hasn't yet happened. But in either case, you are not in the present. Does that make sense? Yeah, so it's really difficult. You're not enjoying anything. You're not taking away anything. Lack of chosen values. So yeah, the idea of feeling stuck, right? Like this is not a new concept. People just say, I just feel stuck. Part of that is not knowing what they want to do, or having conflict between this is what I keep thinking I'm supposed to do, but here's what I really want to do. And so I don't know where to go, right? Values serve as our compass. They serve as the direction that we move in. Lack of action or inconsistent action, right? So you're saying you want one thing, but you're doing something else, or you're not doing it consistently. Attachment to the conceptualized. So this is, I don't think it's CBT, but I forget what theory it comes from. It might be a human development one. But here's my ideal self, and here's the reality, and it's that discrepancy between the two that is harmful. And so when I'm attached to this is how I ought to be, right? I need to be perfect. I need to be the best. I need to be a man. I need to be a mother, a father, whatever. I need to be successful. And the reverse. So think of Jill from the case study, right? I don't think it was explicitly in there. She might think, we see this with when you do addictions counseling. I'm an addict. I'm always going to be an addict. And yes, there is a conversation for people versus person first language and things like that. But the idea that I'm always going to do the same thing over and over and over. I'm a loser. And so, and what we see through research is if a person acts on those thoughts, they will look for confirmation of it, right? Confirmation bias, right? So I'll go and do things, I'll try, but I'm only going to try to the extent, again, it's not an explicit thought. I'll try to the extent that I can say I tried, but I'm going to put in a loser amount of effort so that I can confirm that I am a loser, right? So I'm attached to this idea of myself. I'm weak, so I'm going to keep acting that way, or not acting. I'm going to let that idea direct how I'm going to be. Cognitive fusion, which is the one that probably is most common, or the one that everybody has heard of, right? So you're just tangled in your thoughts. So this would be rumination, right? So the inflexible attention, you're in class and all you can think about is the horrible thing that your partner called you, right? All you can think about is I'm going to fail, right? It's right in front of you. It's directing everything. It's just sort of overwhelming you. And then we have avoidance, right? So when we realign them or address them, no, my slides, my beautiful slides. See, everybody gets on me for not having a design, and this is exactly why I don't do it. Hang on. See, this is what I get for letting my intrusive thoughts win. Woof. So, values versus confusion, right? So, the important thing here is values are not the same as goals. What is the difference between values and goals?
You can make a lot of money, but like your value is to have something financially stable.
Yeah, I think that's great. So a goal tends to be observable. It is an endpoint. So I want to make $1 million, right? That's a goal. Financial stability, or even in that client's case, I want to be successful, right? is a value because you will continue to do that. So somebody, for example, who says, if we're working with a perfectionist and they say, if I say, what do you want out of life? What's your value? And they say, I want to be perfect. You say, okay, well, why do you want to be perfect? Well, because then people will like me. Like, oh, well, the goalpost moved a little bit, didn't it? Right? It's to be liked. So you have friends, right? And that's something that's observable. So now you have friends. Is at the end of it. And well, no, I want to be accepted. Oh, now that's different. Right? Because how many, if the goal is to have friends, how many friends before you reach the goal? How do you define friends? Right? But to be accepted, that's different. Right? And it's something that's ongoing, right? That I can continue to work towards. It could be instead of I want to lose weight, I want to be healthy. Instead of I want a romantic partner, I want a healthy relationship, or I want to be in a committed relationship, something that continues to move forward, that you can continue to refine, and that you can continue to work on improving. And it's through the values that we can also identify some cultural factors. And what we're always asking, especially when the person, well, really, I guess it would be for the behavior and the thoughts they have, is in what way does this move you towards or away from your values? Right? So if you're saying, I want to be a good partner, I want to be in a healthy relationship, but you're doing stuff that violates the boundaries of the relationship, whether it's cheating or lying or just secret keeping, being hostile, turning away and things like that. Looking at those thoughts and asking, is this helping or not? And it always depends. There is no universal answer for these things. And so that's, again, we want the context. Someone says, I want to be in a healthy relationship, but you come home late every night and your partner's saying you don't spend any time with me. And what they're saying is, right, but they're doing all these layoffs and I need to keep my job. Well, then it's a little bit different, isn't it? It's not that you're so not into your relationship that you're blowing them off. Now, why aren't you communicating with them? Is that helping or moving you away from your goal, right? And so we're looking at how is what you're doing and your thoughts moving you towards the value. So the idea of I want to be accepted, I have the thought that I'll only be accepted if I'm perfect. Well, the thought has a function. It's to help me be accepted. But is it functional? No, right? Because it's draining me. It's taking away. So that rule is there, that thought is there, but is it helping? No, right? Is it because my brain is being a jerk? No, it's trying to help me. It's just trying in the wrong way. Let's see if it, oh man, it's happening again. Hold on, my struggle switch is on. Don't save. That's what you get when you give in to peer pressure. So how do we assess for this? Well, you do an assessment. And there's lots of worksheets for it. Act like DBT is very available. You will have no shortage of things. To start, what they recommend, you can do a simple work, health, love assessment, right? How do you view your job or your career, their students, their academics, their responsibilities? How do you view your health? And how do you view relationships, right? And with adults, especially if they're in a relationship, it then becomes especially important. But asking them what they are. And do you think that this is an easy or a more difficult task for clients? Once we really lock down what we mean by values. Right. Why can it be uncomfortable to think about your personal values? Yes, absolutely. What else? Where do they come from? Yeah. So some evaluation. Yeah. What else? Yeah. Yeah. And that's typically, for those that didn't hear Victor, like realizing how not aligned you are with the values. All these things are true. Part of it is just the level of introspection can be difficult, right? Especially if you have come from maybe like a really rigid family where there was a lot of this is how things should be, or a very enmeshed family where we all share the same things. It could just be that you have historically felt ostracized, right? You grew up as an artist in a household of athletes, right? And so you might feel hesitant to trust what you want, and it can be overwhelming. What I have done is I usually give some homework, and there's a sheet of like 10 different values, from education and relationships to like civility and like parenting and stuff. And not all of them are going to apply, right? Like there are people who are like, I'm not a parent and I don't want to be. I'm like, so I've been very successful at that, right? And so, and that's fine. We're only interested in the ones that you're struggling with. It's not that we're only interested. Those are the ones that are especially notable. And on that will be a space for how you define that. So you say that you want to be successful. What does that mean? You say you want to be healthy. What does that mean? How important is it to you on a scale of 1 to 10? And then how successful have you been at it? So what would it mean then if someone said, this is a 10, meaning it's very important to me, and I've been very successful at it. So a 10 and a 10, what would that suggest? Yeah, they're in line. You're doing it, right? Now, if someone said, I want to be healthy, and they score themselves, it's very important, it's a 10, but they only give themselves like a 4 on success. What does this suggest? Yeah. So what might we ask afterwards? Yeah. Yeah. What's happening here? So somebody with substance use, right? Say sobriety and recovery is so, my sobriety is so important to me. And they continue to use. And so upon reflection, like Victor said, they're like, oh, this is out of whack. It's, well, what's going on? Why is that? And sometimes there are very real world reasons for what's going on. It's when it's the person's internal chatter, the private experiences. So that substance use, like Jill in the case study, I want to be clean and sober. I want to get into recovery. But when I'm sober, all the feelings come back. And so I'm not successful because I don't want to think about it. So I get high so the feelings go away. So to improve means to manage that discomfort, right? Someone on a lighter note, someone says like, I want to, I want to go to the gym. And so you say, do you go? No, because I don't want to have people look at me. I don't like the way my body feels, right? And so that's a very common concern. And it might be shifting the goal for that value. So instead of going to the gym, could you work out at home or go for a walk or do something different, right? And so helping identify where is the sticking point for it, right? And so we're always looking at, is it workable? Is it functional? Is it realistic? All of those things. to help identify what is the value and what would it look like if you were living according to those values. Thoughts, reactions? Again, we're not getting caught in the minutia of, do we think it's valid? It's just more important that they identify what they are, even if it's different from ours. Committed action. So this is the doing part. And so it's kind of a two-part thing. It's one, literally doing it. You say that education is important to you. That's a value of yours. So you study and taking steps towards it. That's kind of the surface part. And beneath it is that you're owning that behavior. I'm doing this because it is helpful to me to achieve my value, to work towards my value. It's not just rote going through the motion, right? Because we can all do that begrudgingly, right? But for committed action is I'm doing it because it's an intentional behavior that aligns with whatever that value may be. You're not avoiding stuff, and you're not acting impulsively. There's a degree of consistency. That doesn't mean that you can't experiment, right? So in the case of like people going to the gym, if you're not into like cardio and running, what about weightlifting? If you're not into that, what about swimming? So it might take a minute to figure out what you want to do, but you're not just sitting saying there's nothing for me, I can't do any of it. You're making a concerted effort to make decisions and live according to your value. Some of the activities that you can do to help increase this is helping them. A lot of it just revolves around you can do something and be uncomfortable at the same time. For people who have chronically avoided that, that's really difficult. So we start with a little bit of discomfort, right? Or even pointing out, well, you're here talking to me now. Is this uncomfortable? Yes, or when they say I don't want to talk about it, but you are talking about it, and that's great. I know people who have said, could we sit on the floor and have our session, right? Can you go into the because I can? Could you go take a cold shower, right? That would be really uncomfortable. Well, I think it would be uncomfortable. It'd be uncomfortable, but you did it simply because you could, right? The goal is to understand that I can do stuff even if it makes me uncomfortable. Because again, for ACT, the person is not moving forward, they're not taking action to avoid discomfort. So is there something small that you could do, a little bit of behaviorism, right? That you could do if you don't want to, go for a walk in your neighborhood, would you be willing to just walk around your house, right? Would you be willing to just walk from one end of your house to the other? And so it's the idea of learning, I can do it. And that's sort of the folly about avoidance. By avoiding, I never learned that I'll survive, right? And again, that is what your brain is trying to do. If you go out, it's going to be horrible and you're going to get hurt, right? But if I can start testing it and say, yeah, sometimes that might happen, but not all of the time, we're moving in the right direction. So we might have to start small. What it'll be, that depends on the context and what they can do, right? If you're working with kiddos, it's going to be very different than if you're working with adults. We are not suggesting anything wild, like, try smoking a cigarette to see if you can, it burns or something like that. Just like something safe. I shouldn't have to say that, but I also don't trust y'all. Contact with the present moment, staying here and now. And so this is something that personally, I have to do a lot of the time, right? So shout out to the rest of you that ruminate on everything. Being present, listening, grounded and centered, right? You're not worrying about the future. You're not ruminating. And, these things all serve a purpose. Rumination is to, help prevent something that has happened, or to, I read a really interesting theory on rumination about it's you analyzing a situation so that you can do better the next time. Worrying is about preparing right? So these strength-based approaches, but in either case, I am not in the here and now, right? So this is, have you ever, I was gonna say, have y'all ever read something in your grad students? That's all you do. You're reading and you have to read the thing over and over again because you literally read the words, but you didn't take anything in. Yeah, that's what this is. Like you are going through the motion, or if you've had to rewind something because you keep missing what the person is saying, not because you didn't hear it, but because you're distracted. That's what this is. It's to be here so that you can experience whatever it is that you need to experience. Sometimes it's something fun, like seeing a movie or eating, right? Other times it's, I need to hear my partner or my family member talk to me about something. Sometimes it's listening to our clients, right? To be in the moment. And the way that we can do this is through like the standard mindfulness techniques, grounding, meditation. Russ Harris is, he does use the word mindfulness. He's also aware that mindfulness, that term can carry with it like elements of spirituality, and different cultures might view it very differently. And so a different word might be awareness, right? And so what he has is called dropping anchor, and it's something that we teach clients to do, right? Which is to be aware of your surroundings, pull yourself to your body, focus on a physical sensation, right? And doing the, you know, what are the 5 things you can see and all of that, but coming back to the present moment. The purpose of mindfulness, and it's important to explain it to clients, is that, yes, having a clear head is great. That is not the end goal for mindfulness. The end goal for mindfulness is to be able to regulate our thoughts. And so, for example, if you've never done mindfulness, and I sat you down and I said, let's do this, what do you think is likely to happen to you as we're trying to do it? Your mind's going to wander. Yeah. Every client I've ever had that I've done mindfulness stuff with will say, I can't stop thinking, or I don't like it because I have all these negative thoughts. And that is 100% normal, right? Without something to focus on, everything just kind of comes. The goal is not to just like let it dissipate. The goal is to exercise a muscle in a way. I feel like I'm using a lot of gym analogies today. It's my guilt. Is to be able to select what you want to pay attention to, right? And if we can do that just internally, then we can extend that so that when I'm in class and I start ruminating or I start worrying, I'm able to say, my mind is wandering. I need to pay attention. I don't want to do that. Or like, I can do this later, and pull myself back to the present moment. In arguments with family or partners, you get into an argument and there's that tendency to do the stuff like, this is just like last time, and you get flooded with past arguments and instances. That's not helpful. You're getting flooded, and being able to select, I want to focus on this issue, not the issues that have already come and gone. I just want to do here. And so mindfulness is not just the clear-headedness, that is a benefit, but the longer term benefit is the ability to help manage our internal experiences. So together, this makes our commitment and behavior change process, right? That we know what we want to do, we know where we need to go, I'm taking steps. The contact with the present moment also helps with decision making, right? Is this what I want to do? Is this what I need to do? On the other end of it, we have fusion and diffusion. And fusion is when your thoughts are like front and center, right? Again, the goal is not to get rid of all your thoughts, right? I don't think there's any theory that that's the goal. With fusion though, and this is what we'd have clients do, so, and you guys can do this, is here are your thoughts, and you put them right over your face, right? It's really hard to do anything when you're sort of blinded by whatever thoughts you have, which explains why when people have thoughts like, I'm a failure, I'm a loser, I'm no good, will then sort of inherently, or not they will inadvertently take steps that sort of support that thought, right? And so fusion is sort of this at its most extreme would be OCD, right? Where I'm obsessive over the thoughts. It's not only an OCD. Think of loss of a job or grief or breakups, right? It's easy to imagine somebody being really distracted with those thoughts. And so what we try to do is to diffuse it, right? To maybe put some space between me and the thought. This is known as unhooking. I'm unhooking from these thoughts. And there's many ways that you can do it. One of the most common ways is to acknowledge, well, they're all acknowledging the thought. One of the most common ways is to thank your brain, right? Like we said with Destiny, she's getting overwhelmed, I'm gonna get rejected again. To say, thank you, brain. I know you're just trying to keep me safe. Like acknowledge it and engage it. You're not needed right now. Thank you, brain. And for some people that's sufficient. For a lot of people, we have to take it a little bit more. And so we take whatever phrase or word it is, rejection, loser, and say it over and over again, right? Loser, 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 loser. And eventually what happens? It's just a sound, right? You know, like, did you ever do that as a kid? You just like milk, milk, milk. And then you're just like, oh, what is milk? Who am I? Right. And so saying it to the point where it loses its meaning. And this is stuff you do in session, right? They can do it outside, but we'd also do it in session. And it's to the idea of, see, that is separate from you then, right? It had power over you. And now it's kind of separate. And now you can decide how much do you want to indulge it. The other one is singing it. And so like some of you get to hear it twice now. But like if you do something silly with it, and so I think they say, do it to like the happy birthday song. Loser, 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 loser. And you're right, and do that because it makes it sort of depowers it, right? And so as you separate it and it has less of a hold, what we can do with a client then is say, okay, you have the thought that you're a loser, you have the fear that you're going to be rejected, you have the discomfort of whatever. What would you like to do while that is there with you, right? So maybe you are going to carry it with you, right? Because if people could just let something go, we would not have jobs, right? And we'd all be happy. And so you're going to carry this. What would you like to do while you're carrying it? Is it that you want this thing like right in front of you, so it's the only thing you see? Are you going to make your decisions based on where you can put this, right? There's no table in this room, so I can't set it down. So I guess I'm not going to go in that room, right? And so that can only happen if the person can separate, put that distance between them and their thoughts. And that ties directly into this one. Self is context. With this one, this is being able to observe yourself. And to notice, I'm having the thought that I'm a loser. I'm having the thought that nobody likes me. I'm experiencing fear of rejection, right? So I'm observing myself. The opposite of this would be just to accept those things are true. I am a loser. That is part of my identity. I am a failure. That is who I am. Versus saying that thought is something I'm experiencing, that thought is something I have. And it might sound like semantics, right? It's only by separating it from the person that they can do anything with it. Otherwise, they're just kind of like, that is who I am and I have to act accordingly, right? And so we would hope if this went well, they would say, I'm experiencing that thought. The analogy I like to give is imagine a pond and there's all these fish in it, and each of the fish are your thoughts and your feelings. you in this analogy are the pond. You are the thing that experiences everything that's going on inside of you. It doesn't exist outside of you, right? It might be you're the only person that thinks you're a loser. You're the only person that thinks you have to be perfect. It's a thought separate from you, just the same way a fish is separate from a pond. It just happens to be that the fish resides in a pond, right? The pond and the fish are not the same thing. And so you being able to separate it helps. And that moves us to like a really cognitive thing of if Alicia is my client and she explains to me she has to be perfect or she won't be accepted. I'll say, I want you to be a movie director. And I want you to tell the actor or actress that is playing you what to do. What would you tell them to do to live according to your values? Right. And part of it is just kind of that separation, right? That itself is context. You're directing, you're telling me what you would otherwise do, but you won't do it yourself. Right. And so by separating it, this helps them, helps clients see or hear this is what I would like to do, except I'm having this thought that keeps me from it. Right. It helps pull into alignment the values and separate the thoughts. It does tend to be like one of the headier pieces of it. The takeaway is just to help them understand just because you think something does not make it true. Right. So what's at the end of every rainbow? Pot of gold, right? And Trevor, God bless him, he goes to the end of the rainbow. Does he find the pot of gold? No. One day, just haven't found the right rainbow. Yeah, that cognitive dissonance, man. And so just because we think that, right, you all knew the answer to it, the same way if I said, every Easter, what creature puts eggs in your yard? You would all say a rabbit or a bunny or the Easter bunny, right? But you all know, like, hopefully that's not a real thing, right? Like, I hope, like, I'm not breaking any hearts. And so just because you think it does not make it true, right? But so many people, including people here, have a thought and it just sort of becomes part of our script, part of our reality. I am this way, so I have to be this way. Can anybody guess what it sounds like in real life? Like people will articulate this to you. They don't know that's what they're doing, but what does it sound like? I guarantee each of you has said something similar to this at some point. Not without giving away the answer. Okay.
If you rephrase the question.
So if Aliana gets really hot whenever she doesn't get what she wants, she gets really amped up. And I say, why do you do that? What would her response be? That's just me. What's another version of saying that? That is correct. There's just other versions. No. I'm just the type of person that does that. I'm kind of a hothead. That's just who I am. I'm reactionary. I'm passionate, right? And it's used not as an excuse, but as the framework for the person's behavior, right? So I have a temper. I'm just the sort of person that doesn't do this. I don't trust people. And those things may be true. You may have some trust. You may have some anger stuff. You may have whatever, but you're just sort of acting on it without separating it. So because you've had these experiences, because you have questions about trust, or because you experience anger, you're telling me you have to act that way. You have to behave accordingly. And so that's self as content. Self as context would be, I do have those things, or I do feel those things. I am not those things though, right? Again, just because I experience it or think it doesn't inherently make it true. All that's true is that I experienced it. And then acceptance. And this is difficult in a fun way. Because if you just immediately brought up acceptance to somebody and you said, well, you can't change them and you're not going to change. So I guess all that we have is acceptance. What is the client likely to say? Yeah, so I'm just supposed to be okay with it? Right? You want me to be okay with this situation? And acceptance doesn't mean you like it, and this is really critical. Acceptance does not mean that you like it, doesn't mean that you condone it. At a minimum, it means that you acknowledge it. This is the situation, and I don't like it, or I do like it, or whatever it might be. And you can very easily swap in the word willingness. Right, so I was talking about how grad school is difficult and it's time consuming and tiring and all these things, but you are willing to still go through it. Why?
Because
It'll amount to something, right? It's in service of something bigger, right? So I'm willing to do that. You're willing to accept family members or partners despite their flaws because you value that relationship or you value them. And that is sufficient for clients if you want to talk about willingness. To get nitpicky, Hayes makes this distinction. Willingness is a necessary part of acceptance. Willingness, we don't want to come across as you're just tolerating a situation. So acceptance would be, this is part of it, and I want all of that. And that means I take my partner and everything, and I can try to find this is part of the relationship that I want. An imperfect partner who's also with me, who's imperfect, and we are imperfect together, right? Grad school, going through, it is difficult, but I want, it is in service of refining me or refining my education and my decision-making and problem-solving skills. You don't have to get that nitpicky in session. It's just acknowledging that you're willing or not willing to do something, right? This is where somebody can say, no, I'm not willing to do that. So think of cases where couples where maybe there's abuse, right? And person says, I will not stand for abuse. I'm not willing to stay in this relationship. That is still committed action, right? You're accepting of leaving the relationship despite maybe the agita and discomfort that comes with leaving a relationship because your value is safety and health and wellness, right? So we can maneuver around a situation and re-examine the context for it. But it's not just to tolerate, and it's also not just being okay, right? Just get over it, right? That's not at all what we're suggesting. And that brings us to our one of the bigger activities for ACT, the choice point. And this is something that y'all can do in your lives. And what we want to know is, given any situation, and the situation includes your internal experiences, it's not just the external thing, right? It's how you feel and what you think about it. And when we're hooked on our thoughts, right? Numbers are hard, and I've got to take psychometrics, and that's hard. And I'm going to kind of carry on as though I'll never understand it. That moves us away from our value. And when we're unhooked and we're able to say, yeah, I am experiencing some stress over it. I'm not comfortable with numbers. Math has been hard for me. And I'm going to be mindful and present. And I really want to get through this degree. I really want to be a counselor. I know I got to go through it. So I'm going to go through it as best I can and be accepting of it and not avoid it. Then I'm moving towards my value. So in other words, that's just a long-winded way of saying, is this moving you closer to or further away from your values, right? You're telling me that you, when I work with college students, that you want to go to medical school or law school or grad school, but you keep skipping all your classes, right? Or you're doing stuff that's getting you removed from campus. You're telling me that you want to have friends, but you find a reason to avoid all the time, right? Is what you're doing moving you away or closer towards your value? Being mindful of time because I'm down to like the last couple minutes. So just a couple other ways of looking at it is that with ACT, flexibility is about opening up, being present, and doing what matters, right? You're making intentional decisions, but it's difficult to have any intention if you don't know where you're going to go, right? And that's why the value part is important. Being present helps you make informed decisions, right? But to be present, I also have to be mindful of the thoughts I'm having and what they mean, how much of an influence they're having on me, right? So if you're someone who just says, oh, I've always struggled with number, I'm not a numbers person, right? Well, that self is content, right? You've already decided you're not going to do well in this class versus just acknowledging, yeah, sometimes I think I suck at numbers. Maybe I can set that thought aside. One of the things I do a lot with clients, I would do it with y'all if you came to me for office hours and were struggling with it, is when you're having those thoughts, just because you have them does not mean you have to engage them. It might be really difficult, right, at first, but can you imagine kind of a bookshelf behind you, right, where here's the thought, numbers make me uncomfortable, or I'm trying to celebrate my son's birthday and I'm thinking about whatever work I have to do. I have that thought. Is there any way that I can just put it on this shelf and I will manage it later, right? But right now, what's important to me is to be with my family or to focus on learning this. And then I can return to this when I want to, versus just ignore it. Don't let it get in the way. Let it go. That's asking too much, right? But by acknowledging that you have it, and that it's just a thing that is happening to you versus a part of you, then you can say, you know, I don't feel like dealing with this right now. Think of in your own lives. Have you ever had a situation where you're like, I'm not going to deal with this right now? Yeah, you know, you want to go have a good time. Or a lot of times, like when I have to get something done, and like one of my kids is like, I want to tell you about this thing, and I'm right in the middle of something, or I'm going to go to see one of my go to one of my clients, and my daughter will say, look at this, or my son will say, look at that. And it's like, rather than force it, right, where I might not really pay attention to what they're saying, is saying, I really want to give you my full attention so you don't feel blown off. Can we do this right after I have this meeting? And that way I am living to my value, which is I want to be a good dad, right? And also I want to manage the stuff that I'm obligated to, right? And that is a healthy way. If they came to me and they said, oh my God, I really hurt myself. Yeah, absolutely. I would help them rather than go to the session, because that is part of being a good parent, is making sure my kids are safe, right? So again, we're back to the context changes things, right? So everything is viewed within the context that it happens. Why did it happen here but not here, and so on. All right, any questions, thoughts, reactions? I know there's a lot of information. Is recorded, and I have no doubt that you will listen to my sultry voice every night. So with integrated behavioral health, with the couple minutes I have left, ACT is used quite a bit with health-related issues. It's used a lot in physical therapy. It's used a lot with diet issues. So people with diabetes or chronic and like metabolic syndrome and things like that. It's used a whole lot because a lot of what's going to happen with a person, let's say that someone's in an accident, they need physical therapy for their leg, the pain is really uncomfortable, or an athlete gets injured in such a way that they can no longer compete, right? There's a lot of stuff there. And like, that's what really drew me to acceptance and commitment is there's no amount of changing the thought. You really want to be an athlete. And now you can't, like, we're not gonna, like, did you really want it? Is it really that big of a deal? Right? And like, not to minimize CBT, I know I'm being very kind of surface with it. Instead, it's accepting that is really hard. I cannot imagine what that is like. What do you want to do? Right? How can we, why did you want to be an athlete? Well, because I wanted to have a lot of money, to make a lot of money, right? Okay, so financial stability. It's because it was who I am, so identity, right? And so with chronic pain, it comes up a lot where people might have recurrent pain. And so it's instead of saying I am kind of a dysfunctional person or I have a dysfunctional body, it's acknowledging I have this pain and it is awful. And kind of the grounding and mindfulness techniques can help regulate that with pain management, but also realizing that the thought of you are less of a person or less of a human because of this condition is going to prevent you or has prevented you from pursuing the things that you want to do, right? Once, especially if it's kind of a sudden change. Dieting, right? Somebody gets a diagnosis of diabetes or high cholesterol, heart disease, any of that stuff, right? But food was a really big part of their life. It's a big part of all of our lives. And so they really want to enjoy it. Switching diets is really difficult. Going from the food you enjoy to maybe food you don't enjoy as much, but it's healthier for you, right? And instead of doing the thing where it's like, really, is a salad that different from a burger? Yes, it is. Of course it is, right? But trying to convince them like it's just as good is not going to help, right? Instead, it's like, yeah, that is really awful, right? I can imagine eating a salad. And then saying this is in service of being healthy, which is what you want to do, right? But it's acknowledging that it's frustrating. And then what do you want to do with that frustration? In your frustration, you might be really grouchy with your partner and your kids, or you might be difficult to work with because you're so frustrated. So it's less now about the salad and the change in your lifestyle and more about how you're handling the discomfort of changing it, right? So again, we go from it's not just the situation outside of you, it's how you're handling the discomfort internally, right? Are you so kind of angry that you're now unapproachable? And so now people don't talk to you and now you feel isolated, right? Versus saying, yeah, this really sucks and I wish it was different. Russ Harris, even in his experience, when people say this really difficult experience, something good can come from it, right? This is a good thing, right? You do not have to do that. And he was like, yes, growth can happen, right? Post-traumatic growth is a real thing. And growth does occur through difficult times. And also, it is completely okay to be like, and I still wish it never happened, or I wish I would have gotten the growth without all the discomfort, right? So we don't need to go to try and reframe things. It is literally accepting or acknowledging that that is frustrating. What do you want to do with that frustration, but not changing the content of it, right? Thoughts, questions, reactions? So the last thing I'll say is that ACT is an empirically based thing. So there's lots of data on how it's effective. And there's lots of really great books. After I brought 2 really good ones, I have lots of resources if anybody would like other ones. I encourage you to explore it and like kind of look at it with you. I know this is a lot. It took me a minute to really kind of lean into and like, no pun intended, to like kind of accept all of it. Just because there is a lot of moving pieces and there's lots of different explanations for them. If it's something you're curious about and this kind of turns you away from it, don't turn away from it. Just turn away from me and go explore other explanations for it, because it really is a useful technique or a useful theory that gives a lot of variety to a lot of different issues and a lot of clients. And it's a very approachable thing. It does just take a minute to kind of conceptualize how all those 6 processes work together. Last thoughts, questions, because I want to be mindful of Dr. I's time. All right, I think that's the last one. Yes. Thank you. Like I said, if you have questions or you want other resources, just let me know. Victor can vouch for me. Yeah.
Okay.
Yeah. Too thorough. Sent him the whole Wikipedia link. All right.
Thank you very much. That was very, very helpful. So let's go ahead and take a 10-minute break. And then when we come back, we'll do the VR head part. But let's give Dr. Leeth another round of applause. That was.
Thank you.
Back around 12, and then we'll begin our activity. Thank you again, Dr. Leeth.
My pleasure.
Cause I remember this similar presentation or like overview of ACT in like couples counseling, is that? the
Yeah.
same
Mhm.
kind of-
This one's just more in depth, has a little more
Yeah,
substance to it.
I remember, after taking that class with you and that presentation, like really kind of leaning towards ACT.
Yeah.
Kind of like circling back.
Yeah, I mean, I was not one of those people who like, I read it and was like, this is the one.
Yeah.
You know, I remember feeling that way with DBT when I learned about it. With ACT, it was sort of like, really, I think with my own stuff, which is not